Naza na bana mibale na bala tukabwana papa bana ngai. Na opesa bango conseil beke maladie na so beli anku ko banga ko kende te po eza maladie moko ba yeba ko soigner bato bien. Et puis so ko hôpital na bango ndenge ezali na ofuta mbongo te o ko dépasser le côté ni 10 francs. Eza kolia no komela makambo nyonso.
Elle est sortie guérie et nous prenons plus sa charge psychologique.
Ndenge tozaki na bana wana ba traité bango bayokaki pe bien babimi bazongi ndako. Nakende kaka soki pe ba monani mosusu na garder bango. Naza na bana mibale na bala tukabwana papa bana ngai. Na opesa bango conseil beke maladie na so beli anku ko banga ko kende te po eza maladie moko ba yeba ko soigner bato bien. Et puis so ko hôpital na bango ndenge ezali na ofuta mbongo te o ko dépasser le côté ni 10 francs. Eza kolia no komela makambo nyonso.
Elle est sortie guérie et nous prenons plus sa charge psychologique.
Ndenge tozaki na bana wana ba traité bango bayokaki pe bien babimi bazongi ndako. Nakende kaka soki pe ba monani mosusu na garder bango.
Honorable Ministers, distinguished delegates, we are about to resume the 70th session of the Regional Committee for Africa. Thank you very much. Honorable Chair, Honorable Minister of Health of Congo, the floor is yours. Thank you, distinguished delegates.
Ordinateur là.
Celui-là.
Oui.
Je pense que là, c'est bon. Je pense que là, c'est bon.
Oui, là, c'est bon.
Ouais. Bien, c'est bon. Là, c'est bon. Ah, même ce que tu m'as envoyé là, je ne vois pas. Regarde.
Good morning, honorable ministers. Good morning, distinguished delegates. Can we kindly ask you to mute your mic while when you're not taking the floor? Honorable Minister of Congo, Honorable Chair, the floor is yours when you're ready, Honorable Chair.
Thank you very much, Pamela. Do you mind giving me 2 minutes to make sure that my connection is working quite well? I'm almost ready. Just
okay,
2 minutes.
Thank you very much. Okay, we should wait for 2 minutes.
Will be enough.
Yes? While we will take this occasion to make some announcements while the Honorable Chair, Honorable Minister of Health of Congo is ensuring that she's very well connected. My colleague from the Secretariat will make a few announcements. Ada, over to you. Thank you.
Thank you very much, Pamela. Distinguished delegates, honorable ministers, good morning. I will make a few announcements. The first one regards the oral statements to be read during the resumed session. For your message to be conveyed and understood with greater clarity, please could you provide a copy of your text to the interpreters before you take the floor. All written contributions are to be sent to interpretationafro@who.int. We will share that email address in the chat box so that you can have it readily available. Interpretationafro@who.int. Member states are reminded to read at a moderate speed so that the interpreters can follow. The second announcement regards the Zoom link. We would like to request the delegates to ensure that they keep themselves on mute when they are not taking the floor. We would like to request all delegates to ensure that their microphones are muted when they are not taking the floor. Member states can be able to take the floor by clicking under participants and raising their hand on the raise hand function if you would like to take the floor. Thank you very much, Pamela, and over to you.
Thank you very much, Beda. Thank you.
Thank you. I hope everybody can hear me. I think my connection is better now.
Yes, Honorable Minister, we can hear you very clear. Thank you. Over to you.
Mesdames et messieurs les ministres, distingués délégués, chers partenaires, mesdames et messieurs, j'ai le
Oui, bonjour Madame la Ministre, c'est Dr Moeti. Nous ne vous entendons pas pour l'instant. J'ai vu votre message sur le chat. Je crois qu'il y a un problème de la connexion. Ok, vous êtes muté pour l'instant. C'est ce que je vois. Madame la Ministre. Voilà.
Est-ce que vous m'entendez maintenant?
Oui, très bien. Merci.
Je suis désolée que la technologie nous joue des tours aujourd'hui. Moi, je ne vous entends pas et j'ose croire que vous m'entendez. Je voulais distinguer délégués, partenaires, mesdames et messieurs les ministres. J'espère que vous m'entendez maintenant. J'ai le plaisir donc de vous accueillir à la reprise de la 70e session du Comité régional pour l'Afrique. Mesdames et Messieurs les ministres de la Santé des pays membres de la région africaine de l'Organisation mondiale de la santé et chers collègues, Monsieur le directeur général de l'Organisation mondiale de la santé, Madame la directrice régionale pour l'Afrique de l'Organisation mondiale de la santé, Mesdames et Messieurs les représentants des organisations internationales et partenaires au développement, Mesdames et Messieurs les délégués à la 70e session du comité régional de l'Organisation mondiale de la santé, distingués invités, toutes préséances respectées, Mesdames et Messieurs. Il me revient encore le grand privilège.
Allô? Oui. Oui, allô? Oui, si tu peux pas.
Oui, il me revient encore le grand privilège de prendre la parole ce jour à l'occasion de la cérémonie d'ouverture de la reprise des travaux de la 70e session du comité régional de l'Organisation mondiale de la santé pour l'Afrique, qui se tient toujours, hélas, dans un contexte de crise sanitaire mondiale découlant de la pandémie de Covid-19. C'est l'occasion de féliciter la République démocratique du Congo, l'Organisation mondiale de la santé et tous les partenaires impliqués pour avoir mis fin à la terrible épidémie à virus Ebola en RDC. Ainsi, après la première partie virtuelle de notre 70e session du comité régional tenue le 23 août 2020, nous voici ce jour à la deuxième session qui sera essentiellement consacrée à deux événements majeurs, à savoir le budget programme 2021-2023 de l'Organisation mondiale de la santé pour l'Afrique et les leçons tirées de la gestion de la COVID-19. Permettez-moi d'exprimer, en ma qualité de présidente de la 70e session du comité régional de l'Organisation mondiale pour la santé pour l'Afrique, mes sincères félicitations pour la qualité du travail et de la préparation au monde virtuel des événements mondiaux de santé publique dans la zone Afrique. Aussi, j'aimerais réitérer nos félicitations au nom de toutes les délégations de la zone Afrique de l'OMS, au directeur général de l'OMS, le docteur Tedros Adhanom Ghebreyesus, pour ses orientations efficientes sur la poursuite de la riposte contre la pandémie de COVID-19 dans nos différents États membres. Au docteur Matshidiso Moeti, directrice régionale de l'OMS pour l'Afrique, pour les appuis multiformes apportés par le bureau régional à travers les représentations nationales dans la gestion de la pandémie à la COVID-19. Pour ce qui est de cette seconde session, nous souhaiterions que les points importants qui ont émergé de nos échanges au cours de la manifestation spéciale sur la situation de la pandémie de COVID-19 du mois d'août soient renforcés et approfondis, à savoir l'engagement politique de haut niveau, le renforcement du cadre de la solidarité et du leadership collectif, le partage des informations inhérentes à la gestion de la pandémie, notamment au niveau des nœuds transfrontaliers, l'intensification de la recherche sur nos produits issus de la médecine traditionnelle afin qu'elle intègre les moyens thérapeutiques, et enfin le renforcement du processus et des mécanismes d'accès aux vaccins contre la COVID-19. C'est aussi l'occasion de réitérer notre engagement de préserver les acquis et de travailler ardemment et ensemble à contenir l'éventuelle deuxième vague de la pandémie à coronavirus COVID-19 en Afrique. De même que de créer des synergies pour lutter contre le relâchement observé ici et là, en renforçant la communication et la surveillance épidémiologique, premier rempart contre les comportements à risque et le non-respect des mesures de prévention. Mesdames et messieurs, je voudrais dire combien nous comptons sur l'appui de l'Organisation mondiale de la santé, sur l'appui que l'Organisation mondiale de la santé apporte au pays, et je suis persuadée que ce soutien va se renforcer grâce notamment au processus de transformation que l'organisation a engagé. Mesdames et messieurs, je voudrais saisir cette occasion pour remercier les vice-présidents et les rapporteurs qui ont apporté leur appui dans la préparation de la reprise de cette session virtuelle. Je voudrais également remercier le personnel de l'OMS Afrique, ainsi que tous ceux qui ont contribué à la préparation de cette nouvelle session virtuelle et encouragé nos partenaires techniques et financiers, le secteur privé de la santé, à mes collègues ministres chargés de la santé de la région africaine et à tous les délégués, plein succès à la reprise de nos travaux. Je déclare ainsi ouverte la reprise des travaux de la 70e session directrice régionale de l'OMS pour l'Afrique, pour son mot d'ouverture. Docteur Moeti, à vous la parole, s'il vous plaît.
Honorable Minister of Health of the Population and of Women's Promotion and Integration of the Republic of the Congo, and Chairperson of the 70th session of the Regional Committee for Africa, Madame Jacqueline Lydia Mikolo. Honorable Minister of Health of Benin and the First Vice Chair, Professor Benjamin Upatan, and Honorable Minister of Health of Ethiopia and Second Vice Chair, Dr. Leah Tadesse, Honorable Ministers of African WHO AFRO member states and heads of delegation, dear colleagues from UN agencies and other partner organizations, distinguished guests, members of the media, ladies and gentlemen. It's my great pleasure in my turn to welcome you to this resumed 70th session of the WHO Regional Committee for Africa. I'd like to start by thanking the Honorable Minister Mikolo for skillfully chairing the Regional Committee sessions and the recently ended WHA regional coordination meetings. Thank you very much for your support to the Secretariat in facilitating the smooth running of these events. I'd also like to thank the Vice Chairs who have equally well supported our work. As we close in on the end of an incredibly challenging year, I congratulate and commend the courageous decisions and actions of African governments, the perseverance of individuals, and the society and the solidarity of partners in responding to the COVID-19 pandemic in the WHO African region. I'd like to particularly commend the African Union leadership for their strong action, which they organized collectively. Since we last met as a regional committee in August, we've had more than a full schedule of governing body meetings, and I appreciate honorable ministers and heads of delegations, your availability and flexibility, which has allowed us to continue the governance of the organization in this new normal. In October, we held a special session of the Executive Board to review the progress in implementing Resolution WHA 73.1 on the COVID-19 response, including internal and external mechanisms that have been put in place to evaluate the pandemic response. Last week, we concluded the resumed session of the 73rd World Health Assembly and the 147th Executive Board. The Health Assembly endorsed key resolutions of relevance to the region, which were promoted by African member states. These include the first ever resolution to eliminate meningitis by 2030 and a decision endorsing the new neglected tropical diseases roadmap. The global strategy on digital health was also adopted. At the regional level, we're already finalizing draft frameworks on digital health and meningitis, which will be submitted to the regional committee next year. The Assembly decided to designate 2021 as the International Year of the Health and Care Workers. And I concur with delegates who intervened, highlighting that appreciation for health and care workers should include the requisite remuneration and safe working conditions. Infection prevention and control and occupational health and safety should therefore become integral parts of our health services delivery. Other priority issues such as immunization and polio were discussed, and the resumed assembly coincided with the emergency use listing by WHO of the novel oral polio vaccine type 2, or NOPV2. This new tool will help in dealing with outbreaks of circulating vaccine-derived poliovirus type 2, which have affected 16 African countries in 2020. Following the celebration of the regional eradication of wild poliovirus in August, which was a very important moment for all of us, it's imperative that we accelerate the momentum towards ending all forms of polio. This includes integrating polio-related essential functions into national routine programs. The Assembly also held extensive discussions on emergency preparedness and response and endorsed a resolution through which member states renewed their commitments to fully comply with the international health regulations. Several member states, honorable ministers, raised the recent allegations of sexual exploitation and abuse during the Ebola response in North Kivu in the Democratic Republic of the Congo. We are fully investigating these allegations in order to hold the perpetrators to account and prevent future occurrences of this nature, including through the independent commission established by Dr. Tedros, which is co-chaired by two strong African women leaders with very good international profiles. Some good news last week, as the minister said in her opening remarks, we celebrated the end of the 11th Ebola outbreak in Equator province in the Democratic Republic of the Congo. I'd like to appreciate the efforts of the local and national authorities, particularly the leadership role of the Honorable Minister of Health, the work of the frontline health workers, the engagement of communities, and the support of partners in bringing this outbreak to an end while simultaneously fighting COVID-19. Mesdames et Messieurs les ministres,
Honorable ministers, partners, and colleagues, the COVID-19 pandemic was top of the agenda in the governing body's discussions. And our continent has now passed the 2 million reported cases mark, including more than 1.4 million cases and 32,000 deaths in the WHO African region. The holiday season is fast approaching. As we observe, cases surge in parts of Europe and also in the Americas, and an uptick in our regional daily cases graph. We cannot therefore be complacent. We need to prepare for a resurgence of the pandemic, including scaling up precautions in risky situations, such as festive and election-related gatherings. The news of 3 effective COVID-19 vaccines is of comfort to us and has us absolutely determined to ensure that African countries obtain sufficient supplies to make an impact on the pandemic at the same time as all others. Honorable ministers, you represent 47 of the 187 countries that have joined the COVAX facility, which is working with the WHO-coordinated ACT accelerator to ensure that global solidarity and equity prevail in the collective fight against the pandemic. The potential impact of several high-income countries having arranged advance purchase agreements of hundreds of millions of doses needs to be closely followed. Our collective preparations and advocacy will be crucial to make sure principles of solidarity and equity remain at the forefront in the months ahead. We will have an opportunity to discuss these issues in greater detail during the special event later today on the COVID-19 response in the region. In this resumed session of the Regional Committee, we will also discuss the program budget. I will resume. In this resumed session of the Regional Committee, we will also discuss the program budget, as well as the necessity of sustainable, flexible, and predictable funding for WHO to fulfill our mandate in the context of expanding expectations placed on the organization. Several member states called for this during the World Health Assembly, and assessed contributions are only one type of flexible funds that are within the control of member states. You emphasized from the African region the need for adequate resourcing of action by strong WHO country office teams, backed up by regional offices. Thank you, honorable ministers, for the adoption of 11 substantive documents and 7 progress reports on our agenda through a written silence procedure during the intersessional period. This was done unanimously during the period, thanks, as I said, to a written silence procedure. The first ever regional strategy on scaling up health innovations was one of these documents adopted via that procedure. And we have seen this year the important role played by new tools, technologies, and approaches as part of the COVID-19 response. This strategy provides a timely opportunity to strengthen innovation ecosystems so that new ideas and tools can quickly be incorporated into action and services, and also to accelerate progress towards the achievement of universal health care coverage and the Sustainable Development Agenda. Turning now to the priority actions needed in the coming months. Renewed, reinvigorated, and innovative approaches to encourage and motivate communities and reverse the relaxation and fatigue, frankly, in continuing with preventive measures will be needed. In addition to engaged, enabled communities, sustained vigilance will be essential. Through smartly scaled up public health capacities to quickly find, test, and isolate cases, and trace and isolate contacts, COVID-19 transition can be contained. It is imperative that we progress concretely in the planning to roll out COVID-19 vaccines, including preparing for regulatory approvals, delivery strategies for priority groups, and, importantly, securing the needed financing. Emerging challenges, such as vaccine denial among health workers and some clergy, also need to be proactively addressed. Mitigating the socioeconomic impacts of COVID-19, including maintaining access to essential preventive and curative services, must be a key focus, so as to avoid a reversal in hard-fought gains made over many years in health and development. Universal health coverage remains our overarching goal. To accelerate progress towards UHC, the lessons learned in the past year and in previous outbreaks and emergencies must be used to transform our health systems and build resilience. The reports adopted by the Regional Committee this year on strengthening country presence to deliver universal health coverage in Africa and on the performance of health systems are key analytical tools in our work together. These reports set out the capacities needed in each member state and in the WHO offices to support the attainment of universal health coverage. We are counting on the continued support of member states and of partners to ensure that our country officers are adequately equipped to accompany work towards universal health coverage at the national and subnational levels. COVID-19 will not be the last threat we face. So, preparedness needs to be integrated at every level of the health system. The experience of this pandemic has shown the limitations implicit in narrow, fragmented investments in health, and points to the need to build health systems that provide care centered on the needs of people at every stage of their lives. In closing, Honourable Ministers, I assure you of WHO's continued commitment to accelerating gains in health using integrated people and with a strong focus on equity. I look forward to productive discussions and to our continued collaboration towards better health outcomes for people in the African region. Thank you very much for your attention. Thank you, Madam Chairperson.
Merci, merci, Dr. Moeti. Merci beaucoup.
Thank you, Dr. Moeti. Thank you very much. This concludes our opening ceremony. Before we proceed with the next item, the Secretariat would like to make some announcements. I invite Mrs. Peter Takayenzana to take the floor.
Thank you very much, Madam Chair. We do not have any further announcements at this stage. Thank you, and over to you.
I'm sorry, the sound is very poor. Dear delegates, for the conduct of this virtual session, a revised version of the special procedures adopted for the August session has been drafted by the Secretariat and shared with all participants in advance of this meeting. I would suggest that we should proceed immediately with the adoption of the decision concerning the adoption of the revised special procedures to regulate the conduct of the resumed virtual session of the Regional Committee for Africa. Rev 1. I pass the floor to the representatives from the Office of the Legal Counsel, who will briefly introduce the revised procedures.
Thank you, Madam Chair. Good morning to the honorable ministers and participants in this meeting. I would like to say a few words on the revised special procedures contained in document AFR/RC70/decision 1 Rev 1, which are intended to regulate the conduct of the resumed virtual session of the Regional Committee for Africa and are submitted for your consideration today. As you may remember, special procedure had already been adopted in August when the Regional Committee firstly met. Those special procedures, as well as the revised ones, cover aspects related to the participation in the Regional Committee meeting by member states, associate members, committees of the United Nations and its specialized agencies, and other regional international organizations and economic communities, as well as non-governmental organizations. In this respect, the revised special procedure provides for written statements of no more than 600 words in one of the official languages of the African region by any participants on two specific items: the WHO program budget and the special event on the COVID-19 response in the African region. In addition, they provided member states, associate members, invited representatives of the United Nations and its specialized agencies, and other regional international organizations and economic communities are provided with the opportunity to take the floor, while head of member state and associate member delegations also had the opportunity to submit pre-recorded video statements. The revised special procedure further specified that pre-recorded video statements and individual oral statements delivered at the meeting are limited to up to 3 minutes. While the registration component of the revised special procedure was amended to adapt it to the nature of this meeting as a resumed session, and an update on credential will be provided later on, other provisions which already appeared in the special procedure adopted in August remain unchanged. In particular, the decision-making process at the current resumed session, as already previously, should be based as far as possible on consensus. And in any event, given the virtual nature of the session, no decision shall be taken by a show of hands or a secret ballot. Finally, the revised special procedure provides for the publicity of the regional committee meetings, the use of all official languages of interpretation of the regional committee, and the handling of the final report. This concludes my presentation. Many thanks for your attention.
Thank you very much. Are there any comments, any observations? If not, Decision 1, Rev 1, is hereby adopted. We shall now proceed with Agenda Item 3, Adoption of the Regional Committee, Draft Abridged Agenda, and Provisional Program of Work. Any observations or comments relating to the document I just mentioned? Secretariat, perhaps you could assist me if there are any hands raised.
Honourable Minister, there are no hands raised at this moment.
Thank you.
Il n'y a pas d'observation.
As there are no comments or observations, the abridged agenda is adopted. Thank you to all. We shall now consider the provisional program of work for this resumed session. Kindly referred to document AFRC 71 ad 4. Due to requests to finish our meeting early today, I would like to make the following amendments to the program of work. The lunch break will be reduced to 30 minutes. The special event on the COVID-19 response in the region will therefore start at 1300 hours Brazzaville time or earlier if possible. We therefore expect that the committee will finalize its work by 16:15 hours Brazzaville time. I will ask the Secretariat to amend the program of work accordingly and share with all delegations by email. I would like to propose that we limit our interventions to not more than 3 minutes per statement. I will not hesitate to interrupt delegates if they go over time. Delegates should refer to the countdown timer pinned on the corner of their screen. Due to time constraints, statements by non-state actors, NSAs, will only be allowed in written form at this session. Statements received from these NSAs are posted on the regional committee website. Are there any comments, any observations concerning the adoption of the provisional program of work? I see no objections. I'm sorry, I do apologize for the connectivity issues and challenges, but I would like to give the floor to the Secretariat to see if we can have a short break maybe to resolve this issue. My apologies, I also am having difficulties in hearing what the chair is saying, but I think that's what she said.
Honourable Minister, yes, we're having some difficulty hearing you. We're going to suggest if we can have a 2-3 minute break to allow the chair to sort out a connectivity, and then we shall resume the regional committee, if that's okay with you. So honourable ministers, honourable delegates, we are suggesting a 2 to 3 minute break while we sort out the mic, the sound, the audio from the honourable minister chair, and then we shall resume the regional committee. Thank you.
Mesdames et messieurs, chers délégués, mesdames et messieurs les
Ladies
ministres.
and gentlemen, dear delegates, let us go back to the last agenda item, the adoption of the provisional program of work. My apologies for the connectivity issues. We never quite know if it's actually a connectivity problem or what is happening. If there is a problem, I will ask one of the vice chairs to take over from me so as not to disrupt our session further. So we were considering the adoption of the provisional program of work, the revised one for this work. This is document AFR RC71 Ad 4. Due to the request for our meeting to end earlier today, I would like to make the following amendments to the program of work. The lunch break will be reduced to 30 minutes. The special event on the COVID-19 response in the region will therefore begin at 1300 hours Brazzaville time, or even earlier if possible. We therefore expect the committee to finalize its work by 16:15 hours Brazzaville time. I will ask the Secretariat to amend the program of work accordingly and share with all delegations by email. This said, I would like to suggest that we limit our interventions to no more than 3 minutes per statement. I will not hesitate to interrupt delegates whose interventions continue after that time. Delegates are kindly asked to refer to the countdown timer pinned on the corner of their screen, because due to time constraints, statements by non-state actors will only be allowed in written form at this session. Statements received from NSAs will be posted on the Regional Committee website. Are there any comments or observations concerning the adoption of the provisional program of work?
Je ne vois pas d'objection, donc
I see no objections. It is so decided. Thank you very much.
We shall now go on to credentials.
Conformément au paragraphe 11 des séances virtuelles de la reprise de la session, les pouvoirs que les États
the credentials presented by states for the meeting of last August remain valid in accordance with the rules in force for this resumed session.
de leur délégation au moyen de nouveaux pouvoirs. Au cours de la session tenue en août,
during the August session, the credentials presented by the delegates of the 47 member states were found to be in conformity with the rules of procedure. Some delegations have amended their composition, the composition of their delegations since the last session. So the amendments do not call for fresh credentials. At this new session. Distinguished delegates, we shall now consider the adopt the report submitted earlier to the subcommittee on programs. These are adopted without further discussions by the regional committee. We felt that this could be adopted without further consideration by the regional committee. On 14 September, the RD sent to member states list of documents to be examined by the silent written procedure. Member states were invited to indicate in writing before the 20th September any objections to the documents. And there was no objections to any of the documents, so the list was submitted to member states. The regional committee is therefore invited to note that the documents listed in information document AFRO have been adopted through the tacit approval, silent procedure. Thank you. Following the adoption of these documents, in the afternoon, we shall examine the agenda, date, and venue of the 70th session of the Regional Committee. The Honorable Minister's continues to break, so it is difficult to follow from end to end. The budget program budget of the WHO, abridged item 3. I will now give the floor to Dr. Joseph Kabore, Director of Program Management, to present this document. Dr. Kabore, you have the floor, please.
Madame la Présidente, Excellence,
Madam Chair, Honorable Ministers of Health, members of delegations, good morning. This agenda item on the program budget for the next biennial was already presented to the Program Budget Committee during its October meeting. But since the approach had been agreed upon, we felt that it was better to ask our colleague to share the presentation that he prepared at the regional committee sessions of the different regions. Imre is the Director of Planning, Resource Coordination and Performance Management in Geneva. Following his presentation, with your permission, Madam Chair, I would like to present a few slides on some of the implications for our region. Following the two presentations, we shall be at your disposal for the discussions. So with your permission, Madam Chair, I would like to invite Imre to take the floor, please. Thank you.
Imre, you have the floor, please.
Thank you very much, Joseph. Madam Chair, dear Regional Director, dear colleagues, let me present you where we are currently with the preparation of program budget 22-23. Can I have the next slide, please? As you know, that in normal times, we would present a full draft budget for your consideration at the regional committee. but due to the COVID, this was not possible. So what I'm presenting to you is the process and the major strategic thinking, what we have behind the program budget. And you will see the first draft of the program budget leading up to the executive board. We're working very hard on it, so I hope that it will be ready in the next couple of weeks. The program budget is prepared in truly historic times for WHO. There's clearly a unique window of opportunity, but also a duty to rethink the strategic direction of WHO and to position it in a way to tell the world how we're better at facing a next pandemic. Clearly, there are lessons learned already now that we know that we need to change, and they need to be reflected in the program budget. At the same time, we have this dilemma that, as you know, there's this ongoing independent panel review, which was set up by the member states about the operations of WHO, which will also come with very clear, hopefully very clear recommendations on what needs to be changed for the organization. So while we don't want to be static and for the 22-23 program budget act as if nothing had changed, we don't want to, so to say, jump the gun and preempt member states' recommendations, because the challenge is that this IPPR evaluation will be presented at the same time to the member states as the program budget 22-23. So we had the dilemma how to solve that. And basically what we're proposing and what is our solution is a two-stage approach. We are reflecting the changes that we know already now, and that will be presented in the program budget in May next year to the World Health Assembly, but with a clear expectation that we're going to take the recommendations of the IPPR panel very seriously and reflect it in the program budget, and we'll come back to you with the revised program budget in 22 May. So in a way, we do the program budget in two stages. One, to reflect here and now, and then come back once the biennium started and reflect the IPPR evaluation. Next, please. While we're doing this program budget, we want to stick to the guiding principles as much as possible. And these are that the program budget must continue to be member state driven, and it has to be based on the needs both countries and of course of global health. We have to apply, as I said earlier, the lessons learned from the COVID-19 pandemic. We have to be flexible, and we have to constantly adjust and take into account the emerging information and needs, and of course, your guidance. We have to maintain a rigorous and consultative approach, but we also have to be pragmatic and make sure that WHO is operational. And of course, we have to be ambitious because this is a historic time that really requires and maybe gives us the possibility to really think a little bit beyond our usual discussions and needs. Next, please. So I have presented this program budget to some of the regional committees. I've presented it in Euro, in WIPRO, and now to AFRO. We have started the strategic discussions with countries on the program budget at the country level, wherever it was possible in light of the COVID situation. We have ongoing and actually now finalized discussions throughout the three levels of the organization about the outputs. Remember, the outputs are the key building blocks of the budget, and that describe what is it that the Secretariat is going to deliver. The output delivery teams are the mechanism that bring together the three levels of the organization. They have all met, and they have all finalized the text for the next program budget. We're discussing with senior management the key changes which will be proposed. There will be a meeting with DRDs and the DG on the program budget actually next week. And what we are saying is that because of this situation, that we cannot present the regional committees with a full draft budget, we would like to use all opportunities the moment we have the budget in our hand, the document, to have formal and informal consultations, both here at headquarters, but also at the regional level. And we want to make sure that when you see the program budget in January at the executive board, you already understand the key principles behind it. You already had a chance to influence that process. Of course, the budget presented in January is just a draft budget, and then we go back to our normal routine that we hear the member states guidance and suggestions during the executive board, and we will have then time to revisit and review the program budget between January and May when the final budget is supposed to be adopted. Next, please. There are three elements that drive the program budget, and that will be sort of the key that will give the drive the budgetary figures. One are agreements that have been made by member states earlier under the GPW 13, our general program of work. Then, as I said, we have to reflect the lessons learned about the transformation. We have started the transformation process. Not everything from the transformation process has been reflected fully in the 2021 program budget, and they would have to be reflected in the 22-23 program budget. One example is the WHO Academy, or the full implementation of the science division. And then, as I said earlier, clearly the impact of the COVID-19 crisis and the lessons learned on our operation need to be reflected already now in 22-23. Next, please. So what will be different in the 22-23 program budget? We hope that you will see that there's going to be better, greater clarity on the scope of work under each output and outcome. We are proposing to extend the GPW 13. The GPW 13 is supposed to end in 2023. It is very clear that there's already been an issue in reaching the targets, the 3 billion targets by the end of 2023, even without COVID. But now, after the COVID pandemic, it is clear that we won't be able to do that. So our proposal is to extend it by 2 more years to 2025, which will give us 2 more years to work on achieving the ambitious 3 billion goals. We are taking the budget increase projected at the GPW, which foresees a budget of $4.2 billion, and we see how the above required changes would fit within that frame. We would like to there's a huge change, and this is really impacting the African continent, that the polio program is now focusing on the 2 endemic countries, which is Afghanistan and Pakistan, in their operations and on the outbreaks, which means that there's going to be a major shift in polio support for the many countries in the world that have benefited from polio support, and particularly also on the African continent. And it is our task to make sure that the key public health functions that our colleagues from the polio program provided in these country offices are safeguarded and mainstreamed into the program budget. So this will be a big shift compared to the previous times, that the polio budget itself will go down, but the country office budget and the office base functions will have a significant increase, but due to that shift of financing and budget. And then clearly we will again reflect the lessons learned. Next, please. So this is just a reminder that when we presented the general program of work in 2018, we have foreseen a financial envelope basically for every year until the end of 2023. And although this was not an approval by member states, they just noted that element, there's been an understanding that the budget for 22-23, if we want to go ahead and implement the GPW 13, should be in the range of 4.2 billion in 22-23. This would represent a 7.8% increase compared to the 2021 budget. And now what we're doing is that we're trying to make sure that all the proposed changes for the time being fit within that envelope. I have already seen the first figures. It's a little bit difficult to fit everything, primarily because of the polio program. The polio program is so big and bringing the elements of the polio program into the base that it will be very challenging to fit everything within that 7.8%. But this is the starting point, and this is what we're trying to do. But I think it's good for you to see that this is the starting point also of the discussion of the program budget, and you will see how we are deviating from that and why. Next, please. I'm not going to go into details about the programmatic elements, but I just want to say that there are the following areas which we see right now as coming up as the most important focus for the 22-23 program budget. Resilient and health systems and primary health care oriented health systems. So that's one area which clearly is going to be strengthened as coming out from the submissions from our colleagues from technical departments from the regions. Obviously, emergency preparedness and readiness within the WHO program. Essential medicines, vaccines, and diagnostics. I don't need to further dwell on that and explain it why. Linking the work better on determinants of health to UHC and health emergencies. Next, please. And there's also elements in the enabling functions where clearly the investments in strengthening data systems in countries for better surveillance and for better measurement and quality assurance of norms and standards are coming out as a very important emphasis. In addition, we have ongoing transformation initiatives, and we will, which means that you probably remember that the COVID resolution has foreseen or requested the Secretariat to look into a more sustainable financing of the WHO's budget. And this as in seen as one of the key impediments of WHO to be more effective. We are preparing an options paper for the consideration of the Executive Board that would lay out different options on how to bring this issue forward. Of course, that's a very political issue. We understand also that there's an economic crisis which limits the abilities of countries to increase their support for WHO. Nevertheless, we have an obligation and also coming from the resolution to put this on the table. And there are many countries, particularly France and Germany and now several EU countries who believe that this is the time for WHO to put sustainable financing on the table, and we should not shy away from that. So we'll have an interesting conversation about that at the Executive Board. And with that, Chair, I would give back the floor to you. Thank you.
Thank you. Delegates, you now have the opportunity to ask questions or make comments. Please note you have 3 minutes maximum each, and I would ask you to please respect that time slot. We have Madam Pamela Dramé-Avognon, Coordinator for External Relations, Partnerships and Governing Bodies of the Regional Office, who will support me in moderating this session. Madam Dramé-Avognon, you have the floor, please.
Chair, Honorable Chair, we have Dr. Kabare that was meant to take the floor. So if you don't mind, before we pass it on to the delegates, Dr. Kabore was meant to take the floor. Dr. Kabore, over to you. Thank you, Chair.
Merci beaucoup.
Thank you very much.
Pamela.
Alors,
faisant suite à la présentation qui a été faite par Imre, la question
thank you to Imre for his presentation. Now we need to consider the key implications to the African region.
Slide.
Next slide, please.
Voilà, sur cette diapositive, la présentation va se focaliser
you can see that I will be focusing on 5 elements of the program budget.
Le programme général de travail,
the General Program of Works Results Framework,
l'enveloppe budgétaire,
impact, the budget envelope, financing,
également l'extension,
also the extension of the 13th General Program of Work and the engagement of member states. Next slide, please.
Alors, cette diapositive présente le cadre
gives you an overview of the results framework and measurement system to plan.
Ici présenté, c'est le premier élément. Et il est important d'indiquer qu'il demeure inchangé.
You can see that
il
it is very
et nous devons travailler absolument à familiariser.
To make sure we are all aware of this framework. The member states and the Secretariat will continue to use this results framework and measurement system to plan, monitor, and evaluate the impact of our contributions to people's health. The Secretariat is available at all times to give support as necessary, so that we better understand this framework. The next slide, please.
Alors, le deuxième élément,
the second element to consider under the program budget for 2022-2023 has to do with the adjustments in the budget envelope based on lessons learned from COVID-19. We have to look at the budget envelope as adjustments in 3 streams. One has to do with the impact of COVID-19. And based on lessons learned from COVID-19. Sorry, we appear to have lost the speaker for a second. So as I was saying, based on lessons learned from COVID-19 in terms of its negative impact on health systems and on the socioeconomic development of countries as a whole, it is necessary not only to increase the allocations, but also to ensure flexibility of funding so that we can continue to support emergency preparedness and prevention on the one hand, and on the other hand, to guarantee continuity in basic health services, essential health services. One of the lessons we learned is that there is a need for a more efficient mechanism that will help all member states. But above all, we need infodemics. Once the results of the evaluation of the COVID-19 response has been presented to the World Health Assembly in May 2021, as Imre indicated, the organization will then reflect on the implications thereof on the program budget for 2022-2023. Next slide, please. This slide indicates a second budget envelope adjustment for transformation to deliver outcomes. The region's engagements, the region's commitment has allowed us to deliver at country level, supported by strengthened information systems, innovations in digital health, a digital health strategy that will be complemented by allocations across these areas. Next slide, please. On the sixth slide, the third window in terms of budget envelope adjustment, on polio eradication, well, congratulating our region once again for wiping out the wild polio virus circulation in all our countries. We need to remember that member states committed, and we are now encouraging them to integrate polio-related essential functions in their national programs, such as the one for routine immunization. Meanwhile, the Secretariat will continue providing key support in responding to outbreaks of vaccine-derived poliovirus and other essential functions and activities. Next slide, please. On the seventh slide, we are now reaching the third point of the presentation, which highlights the issue of sustainable financing, which is of extreme importance. This will be debated at the 148th session of the Executive Board in 2021. The Secretariat will develop a working paper on this topic, and one of the important issues will pertain to the role of the assessed contributions, not only in improving flexibility and predictability of financing, but also to ensure the independence and integrity of the organization. As you know, these assessed contributions come directly from our member states. Next slide, please. This slide raises the issue of equitable financing, which has a significant bearing on the region, considering these points. 76% of low-income countries are in our region, in the African region. Half, or rather 51% of countries with an SDG index below average are also in the region. 47% of countries with a UHC score below the median are also in our African region. While the mission of the organization, as stipulated under the 13th General Program of Work, includes promoting health and keeping the world safe, the organization is now mandated to ensure it serves the vulnerable as well. Next slide. Slide, please. Here, you will now see a set of slides. This one, in particular, shows there has been significant progress in the decrease of mortality rates under fives and mothers. This compares how mortality rates have decreased with other regions. There has been significant progress. The speaker is just increasing the size of the slide. So as you can see, this is maternal mortality and under 5 mortality, and there has been significant progress. We have substantially reduced deaths in our region. Next slide. These are diseases of great importance to our region: malaria, tuberculosis, and HIV. Here you can also see the significant progress achieved by the region, but we still lag behind the global average in terms of incidence, despite the dramatic progress obtained. The African region will need more resources to do more in terms of progress. Thank you. Next slide. In addition to considering under 5 mortality, maternal mortality, in addition to considering infectious diseases, we also have to consider non-communicable diseases. On this particular slide, you can see obesity, which is a problem that is growing in importance. It's a public health issue in our region, and so more progress is required in terms of obesity. That requires resources to be given to member states. Next slide, please. This slide focuses on HR requirements, health professionals who are essential to strong health systems. If you look at the slide carefully, you will see that the Africa region has great needs, both in terms of nurses and midwives. In Africa, you can see the red arrow right next to the Americas region. Look at the difference, quite significant, as you can see. But also look at the number of people for every medical doctor. Even if we compare with the Mediterranean region, you can see there is a net difference. So on the right, as I was saying now, medical doctors, 1 doctor for 3,324 inhabitants. Next slide, please. IMRE indicated the need for an extension of the program, the 13th General Program of Work, beyond the 2023 date. We believe that this will provide the region with additional opportunities to meet the triple billion targets of the 13th General Program of Work, considering that most of the countries were off track already before COVID-19, and the situation worsened due to the pandemic. So the organization will then need to reprioritize, reprogram, and speed up implementation. The Secretariat will once again be available to provide any required support. Next slide, please. This slide is my final slide. It's the fifth element of the program budget document. It's on the strict timeline presented by Imre. As he indicated, this timeline is very tight. The program needs to be approved at the May session of the World Health Assembly. We believe that consensus in the consultations within the African region was not as expected, probably because of COVID-19. However, we are willing to improve further in our consultation process and would be happy to receive any recommendations or innovative ideas from member states on how to do so. We continue to count on the constructive engagement between member states and the WHO country offices so that we can all deal with the challenges affecting the attainment of the SDGs. And this is all for now. Thank you very much. Happy to answer any questions you may have. Thank you.
Thank you, Dr. Kabore.
Distinguished delegates, you are now invited to ask questions or make comments. I remind you that you have 3 minutes for each intervention, and I kindly ask that you respect the time limit.
Madame Drame Avignon,
Coordinator for External Relations, Partnerships and Governing Bodies of the Regional Office, will now support me in moderating this session.
Will be supporting me in moderating this session. Madame Drame Avignon, you have the floor, please.
Thank you very much, Honourable Minister. It is a pleasure to moderate this session. Honourable Ministers, distinguished delegates, those of you wishing to take the floor, may we kindly ask you to raise your hand and we will ensure that the floor is given to you. To raise your hand, click on the participants and then on the blue hand at the bottom right of the screen. We already have some delegates who would like to take the floor. I would like to call the delegates of Zambia, Kenya, and Botswana. Zambia, you have the floor to be followed by Kenya and Botswana. Over to you, Zambia. Honorable Delegate of Zambia, the floor is yours. Thank you.
Thank you, Chairperson. Zambia commends the Secretariat for the report on this agenda item. We take note of the limitations in the consultative process as indicated in the report, and are encouraged by the realization of the opportunities that still exist even at this time in order for the process to continue. Chairperson, the Africa region experienced public health threats, including Ebola and cholera outbreaks, with COVID-19 pandemic compounding the situation. Zambia sees all these as a constant reminder on the need to build robust and resilient health systems in order to withstand the catastrophic effects of public health emergencies. One important lesson from the COVID-19 pandemic is the need for the Africa region to forge strong partnerships within the region, among member states and regional bodies such as the Africa CDC. We see these partnerships as critical in order to avoid disruptions in essential health services due to the breaks in the supply chain and many others at the time when these services are needed the most. There is also need to invest in the research and development so that the region becomes self-reliant. From the report, we note the passage of some timelines in the high-level consultations and steps, and request the Secretariat for an update on these processes in order for us to appreciate the current status even better. Our appeal to the Secretariat is to ensure adequate attention continues to be paid to the many other areas that have continued to cause morbidity and mortality in our region, both communicable and non-communicable diseases. There is need to allocate enough resources towards malaria elimination, polio and measles eradication, and ensure that going forward, any future public health emergencies do not disrupt the gains already made. We propose to the Secretariat to quickly ensure that all member states at country level are provided with all the necessary information on the status of the GPW13, particularly the results, framework and impact, and funding gaps and resource mobilization strategies, and to enhance engagements on this development process using the virtual platforms that have become the part of the new normal. I thank you, Chair.
Thank you very much, Delegate Dr. Boda. Thank you very much. I would now like to hand the floor to Kenya, to be followed by Botswana and then Mali. Thank you.
Okay, thank you, Chair. Kenya is pleased to be participating in this resumed session of the 70th WHO Regional Committee for Africa, and thanks the Secretariat for convening this session. We take note of the development of the WHO Program Budget 2022-2023 and commend the Secretariat for the overview provided today. We take note of the proposed approach to the budget making process, as well as the emerging needs and priorities that will have an impact on budgeting in view of the COVID-19 pandemic situation. The 13th program of work ushered in a new era in WHO with a renewed mission to promote health, keep the world safe, and serve the vulnerable. Similarly, Kenya ushered in a new era in 2018 with accelerated pursuit of the attainment of UHC for all Kenyans by 2022. Since then, the government has implemented specific policy measures in recognition of the fact that without improved standards of health, our quest for prosperity and a better life for our people would remain a distant reality. The UHC pilot led to key achievements such as the establishment of an additional 200 community health units, staffed by 7,700 community health volunteers. These volunteers attended to over 2 million clients, many of whom were served in their homes rather than having to travel to health facilities. Further, there was recruitment of an additional 752 health workers to narrow the existing gaps. The biometric registration for Universal Health Coverage Scheme beneficiaries commenced this month. Chair, according to the WHO, more than half of all deaths in low-income countries are caused by communicable diseases. Maternal causes and conditions arising during pregnancy and childbirth, nutritional deficiency, and in the recent past, non-communicable diseases. It is important that these health priorities affecting most of the global population are reflected in the program budget. The overarching goal of the Triple Billion target is to deliver impact in countries. We therefore express concern about the shift from the bottom-up process that usually factors in needs and priorities from countries and culminates in a balanced program budget with full ownership of the member states at country level. This approach is particularly problematic when we are all working to ensure that we leave no one behind. In conclusion, Chairperson Kenya recommends that the Secretariat keeps member states constantly updated on the progress and where possible make use of the virtual platforms for closer and richer engagement. In the coming months, WHO's critical role in supporting member states to build resilience in the health systems towards achievement of their national aspirations and international commitments cannot be overstated. Kenya wishes to all delegates good health and prosperity for the remainder of the year 2020. Thank you.
Thank you very much, the distinguished delegate of Kenya. I would now like to pass the floor on to the distinguished delegate of Botswana. Botswana, you have the floor.
Thank you, moderator. Regional Committee Chairperson, who's also the Minister of Health and Population in the Republic of Congo, Honorable Migolo, WHO Africa Regional Director, Dr. Moeti, Africa Regional Minister of Health, good day. Madam Chair, we wish to thank the Regional Director for a detailed and informative report on the WHO Program Budget 2022 to 2023. We welcome with appreciation the Secretariat recommendation for the program budget to take into consideration the need to reflect important changes that are already taking place and wait for the outcome of the evaluation of global COVID-19 response by the Independent Panel for Pandemic Preparedness and Response, the IPPR. The IPPR review will provide valuable recommendations on the priorities based on experiences and lessons learned and the level of investment needed. We note the proposal for the 13th General Program of Work and its triple billion targets to be extended to 2025 to allow time to assess the impact of COVID and fast-track mechanisms to reach them. We wish to express our support in this regard and are confident that the Secretariat will continue to engage and update us in this process. We note the proposed 7.8% increase in the program budget as anticipated in 2022 to 2023 compared with 2020 to 2021, and the three streams of additional budgetary elements that are known to pose an upward trend, which include the COVID-19, polio transition, and the WHO transformation. As such, there's a need to consider the priorities that will be given emphasis in the financing period. We also wish to highlight the importance of assuring efficiency in order to progress towards achievement of the triple billion targets, ensuring that progress is realized at the country levels. Due to the challenges of COVID-19, we have realized the urgent need to build capacities to respond to emergencies and ensure sustainability of access to quality, affordable, essential medicines, vaccines, and diagnostic tools. Madam Chair, we welcome the focus at country level on building unified and stronger data and health information systems and on strengthening analytical capacity so that countries are able to obtain regular, valid, and reliable data. Adopt an incremental approach in rolling out reporting through output scorecard, especially as it relates to country offices. We therefore look forward to the Secretariat's draft proposed program budget 2022 to 2023 for consideration by the Executive Board in January 2021. I thank you.
Thank you very much, Honorable Delegate from Botswana. Chair, earlier we had Mali and Madagascar who'd raised their hands. I would just like to confer with Mali and Madagascar, should they wish to take the floor. If you could kindly raise your hands again. I will give you a few minutes. If not, we understand that you no longer wish to take the floor. Distinguished delegates from Mali and Madagascar, a few minutes to let you know if you would wish to take the floor. If not, yes, I see Mali would still like to take the floor. Oui. Mali, you can have
Bonjour.
Good day.
Oui, le Mali, au nom de Madame le ministre de la
Mali, on behalf of the Minister of Health and Social Work, would like to thank the Secretariat for the quality of the work so far. However, we would like to focus on the issue of human resources for health and the transformation process that is undergoing in our country, because we really need to improve the quality of our healthcare offered. Therefore, we would like the Secretariat to stress the importance of human resources for health and extra funding for our health personnel. These are decisions which we need to take and be validated by our member states. Once again, Mali would like to address its thanks to the Secretariat and the Regional Director and the Chair for all their contributions to this important meeting. Thank you.
Thank you very much, distinguished delegate from Mali. Distinguished delegate from Madagascar, Would you like to take the floor? If we don't see your hand raised, then we assume you no longer wish to take the floor. Chair, I would bear your indulgence just for a second to see if the distinguished delegate from Madagascar still wishes to take the floor. Chair, I see no other hands raised. I will pass the floor back to you. Thank you very much. Over to you, Chair.
Merci bien, Madame Dramé-Avignon.
Thank you very much, Madame Dramé-Avignon. Thank you very much, distinguished delegates. Has the Secretariat any other comments to make? Mr. Chair, with your permission, I would like to give the floor back to Imre in case he would like to add anything at this point. Imre, over to you.
Thank you very much. I just would like to thank you for your understanding and patience with this program budget development process. And I would like to assure you that the moment we have something more concrete, as you suggested, we will use all kinds of virtual platforms to make sure that you're properly briefed, and then there's a good level of discussion before we submit the document to the executive board. And I took note of all your suggestions, and I'm looking very much forward to the next step in the consultation with you. Thank you.
I've seen it. Can you tell them to come back to them?
Merci Imre. À mon tour, je voudrais également...
I would also like to thank the member states for their comments and in particular for their suggestions. I have really taken due note of two comments in particular. Zambia spoke of the need to really invest further in health and development and research. Yes, indeed, research should be a priority for us in the African region of the WHO. I think Dr. Moeti has already taken note of this and has spoke about innovations. And I think that one of the main roles is to really strengthen the activities of research that are ongoing in our region and at large. And as a result of that, we have had some consultations. And very soon we will be contacting member states to come up with a consultation mechanism with an attached timeline. And we hope this will take place before the middle of December, by the 15th of December, so that we can have our first virtual meeting, which will take place then in January. In other words, it would be a meeting of 2 or 3 hours in which we would talk about our priorities and discuss the allocations in our next program budget without really going into details at the country level. So this is what we are planning, but thank you in advance for your feedback and for your comments, so that really this consultative process we have in mind will be an effective one. Thank you.
Chair,
Merci.
I note, sorry for interrupting, but I note that the distinguished delegate of Comoros has raised their hand and take the floor. The distinguished delegate of Comoros has raised, if it's okay. Okay, Comoros, you have the floor.
Merci, Monsieur le Président, chers collègues.
Thank you, Chair. Dear delegates, good day to you all. I think we still need to cover the important topic of UHC, universal health coverage. Thank you.
Chair, I see no other delegate wishing to take the floor. Back to you. Thank you.
Merci bien. Merci.
Thank you.
Distingués donc,
Distinguished delegates, we can take it that the Secretariat have taken due note of the views expressed during this meeting, and this will be considered in the document which will be presented to the 148th session of the Executive Board in January 2021. So we have taken due note of this document. We do understand that Member States will have further opportunities to provide feedback. This brings us to the end of our morning session. We will now have a 30-minute break that will take us to 12:30 Brazzaville time. We will then resume with the special event on COVID-19 response in WHO African region. I therefore would like to invite you all to kindly be ready to resume in 30 minutes time so that we can respect the schedule and complete our meeting on time. Does the Secretariat have any announcements at this stage?
Thank you, Chair. We do not have any announcements at this stage. Thank you.
D'accord, je vous remercie. Donc, nous reprendrons la session.
So, the meeting will resume at 12:30 Brazzaville time, and bon appetit. Thank you, Honourable Minister.
COVID-19 is unlike any health threat Africa has ever faced. Unlike other epidemics, it's threatening all the countries on the continent at the same time. It's also threatening progress with other diseases because of the challenges in providing prevention and treatment services to people during the pandemic.
We implemented bold and stringent measures, including immediate closure of borders as soon as the first cases were detected. The assistance of the WHO was instrumental throughout.
A OMS integrou desde o início a equipe nacional de intervenção rápida, com um elemento importante que ajudou para não só aqui na cidade da Praia, em Santiago, mas em outras ilhas.
The whole policy of preventing this disease, starting by preventive measures, all of these measures were implemented as recommended by the WHO. They supported us in setting a strong surveillance system.
The training we did with the WHO, I can say it was an eye-opener for us.
Nous sommes la dernière ligne sur laquelle l'humanité compte. Nous avons suffisamment des agents qui se sont dit, malgré les conditions, malgré les difficultés, nous nous mettons pour protéger la race humaine.
It's coming at the right time because we'd like to get the health workers up and running.
We make them aware and they be alert. If they see any sign or symptom about any disease, we help them, maybe refer them to any nearby health facility.
Nous nous assurons que tous les passagers qui se présentent puissent avoir le test COVID négatif.
While fighting COVID-19, WHO has also been supporting the Democratic Republic of the Congo to control its 11th Ebola outbreak, which has now been declared over.
When I came, they've been observing social distance. We use water and liquid soap and then sanitizers around, so I feel safe to come to the hospital.
In the past 9 months, through working together, we've come a really long way. But COVID-19 remains a threat. It's tempting to let our guard down, but we must fight the fatigue. Stop before you go out. Put on that mask, put it on correctly, keep your physical distance to the extent possible, and wash your hands frequently. These small acts can stop one of the biggest health threats of our generation.
With me, we are family. Get up, everybody, and sing. We are family. I got all my sisters with me. We are family. Get up, everybody, and sing. Everyone can see we're together as we walk on by, and we fly just like birds of a feather. I won't tell no lie. All of the people around us, they say, can they be that close? Just let it stay for the record. We're giving love in a family dollhouse. We are family. Hey, I got all my sisters with me. Hey, we are family. I got my sisters with me. Get up, everybody, and sing. Hey, we are family. Get up now. I got all my sisters with me. I got my sisters with me. We are family. Have faith in you and the things you do.
COVID-19 is unlike any health threat Africa has ever faced. Unlike other epidemics, it's threatening all the countries on the continent at the same time. It's also threatening progress with other diseases because of the challenges in providing prevention and treatment services to people during the pandemic.
We implemented bold and stringent measures, including immediate closure of borders as soon as the first cases were detected. The assistance of the WHO was instrumental throughout.
A OMS integrou desde o início a equipe nacional de intervenção rápida, com um elemento importante que ajudou para não só aqui na cidade da Praia, em Santiago, mas em outras ilhas.
The whole policy of preventing this disease, starting by preventive measures. All of these measures were implemented as recommended by the WHO. They supported us in setting a strong surveillance system.
The training we did with the WHO, I can say it was an eye-opener for us.
Nous sommes la dernière ligne sur laquelle l'humanité compte. Nous avons suffisamment des agents qui se sont dit, malgré les conditions, malgré les difficultés, nous nous mettons pour protéger la race humaine.
It's coming at the right time because we'd like to get the health workers up and running.
We make them aware and they be alert. If they see any sign or symptom about any disease, we help them, maybe refer them to any nearby health facility.
Nous nous assurons que tous les passagers qui se présentent puissent avoir le test COVID négatif.
While fighting COVID-19, WHO has also been supporting the Democratic Republic of the Congo to control its 11th Ebola outbreak, which has now been declared over.
When I came, they've been observing social distance. We use this water and liquid soap and then sanitizers around, so I feel safe to come to the hospital.
In the past 9 months, through working together, we've come a really long way. But COVID-19 remains a threat. It's tempting to let our guard down, but we must fight the fatigue. Stop before you go out. Put on that mask, put it on correctly, keep your physical distance to the extent possible, and wash your hands frequently. These small acts can stop one of the biggest health threats of our generation.
We are family. I got all my sisters with me. We are family. Get up everybody and sing. We are family. I got all my sisters with me. We are family. Get up everybody and sing. Everyone can see we're together as we walk on by. And we flock just like birds of a feather. I won't tell no lie. All of the people around us, they say, can they be that close? Just let me stay for the record. We're giving love in a family house. We are family. Hey, I got all my sisters with me. Hey, we are family. I got my sisters with me. Get up everybody and sing. Hey, we are family. Get up now. I got all my sisters with me. I got my sisters with me. We are family. Have faith in you and the things you do.
COVID-19 is unlike any health threat Africa has ever faced. Unlike other epidemics, it's threatening all the countries on the continent at the same time. It's also threatening progress with other diseases because of the challenges in providing prevention and treatment services to people during the pandemic.
We implemented bold and stringent measures, including immediate closure of borders as soon as the first cases were detected. The assistance of the WHO was instrumental throughout.
A OMS integrou desde o início a equipe nacional de intervenção rápida, com um elemento importante que ajudou para não só aqui na cidade da Praia, em Santiago, mas em outras ilhas.
The whole policy of preventing this disease, starting by preventive measures. All of these measures were implemented as recommended by the WHO. They supported us in setting a strong surveillance system.
The training we did with the WHO, I can say it was an eye-opener for us.
Nous sommes la dernière ligne sur laquelle l'humanité compte. Nous avons suffisamment des agents qui se sont dit, malgré les conditions, malgré les difficultés, nous nous mettons pour protéger la race humaine.
It's coming at the right time because we'd like to get the health workers up and running.
We make them aware and they be alert. If they see any sign or symptom about any disease, we help them, maybe refer them to any nearby health facility.
Nous nous assurons que tous les passagers qui se présentent puissent avoir le test COVID négatif.
While fighting COVID-19, WHO has also been supporting the Democratic Republic of the Congo to control its 11th Ebola outbreak, which has now been declared over.
When I came, they've been observing social distance. We use this water and liquid soap and then sanitizers around, so I feel safe to come to the hospital.
In the past 9 months, through working together, we've come a really long way. But COVID-19 remains a threat. It's tempting to let our guard down, but we must fight the fatigue. Stop before you go out. Put on that mask, put it on correctly. Keep your physical distance to the extent possible and wash your hands frequently. These small acts can stop one of the biggest health threats of our generation.
We are family. I got all my sisters with me. We are family. Get up everybody and sing. We are family. I got all my sisters with me. We are family. Get up everybody and sing. Everyone can see we're together as we walk on by. And we fly just like birds of a feather. I won't tell no lie. All of the people around us, they say, can they be that close? Just let me stay for the record. We're giving love in a family dollhouse. We are family. Hey, I got all my sisters with me. Hey, we are family. I got my sisters with me. Get up everybody and sing. Hey, we are family. Get up now. I got all my sisters with me. I got my sisters with me. We are family. Have faith in you and the things you do. COVID-19 is unlike any health threat Africa has ever faced. Like other epidemics, it's threatening all the countries on the continent at the same time. It's also threatening progress with other diseases because of the challenges in providing prevention and treatment services to people during the pandemic.
We implemented bold and stringent measures, including immediate closure of borders as soon as the first cases were detected. The assistance of the WHO was instrumental throughout.
A OMS se integrou desde o início à equipe nacional de intervenção rápida, com um elemento importante que ajudou para não só aqui na cidade da Praia, em Santiago, mas em outras ilhas.
The whole policy of preventing this disease, starting by preventive measures. All of these measures were implemented as recommended by the WHO. They supported us in setting a strong surveillance system.
The training we did with the WHO, I can say it was an eye-opener for us.
Nous sommes la dernière ligne sur laquelle l'humanité compte. Nous avons suffisamment des agents qui se sont dit, malgré les conditions, malgré les difficultés, nous nous mettons pour protéger la race humaine.
It's coming at the right time because we'd like to get the health workers up and running.
We make them aware and they be alert. If they see any sign or symptom about any disease, we help them maybe refer them to any nearby health facility.
Nous nous assurons que tous les passagers qui se présentent puissent avoir le test COVID négatif.
While fighting COVID-19, WHO has also been supporting the Democratic Republic of the Congo to control its 11th Ebola outbreak, which has now been declared over.
When I came, they've been observing social distance. We use this water and liquid soap and then sanitizers around, so I feel safe to come to the hospital.
In the past 9 months, through working together, we've come a really long way. But COVID-19 remains a threat. It's tempting to let our guard down, but we must fight the fatigue. Stop before you go out. Put on that mask, put it on correctly, keep your physical distance to the extent possible, and wash your hands frequently. These small acts can stop one of the biggest health threats of our generation.
We are family. I got all my sisters with me. We are family. Get up, everybody, and sing. We are family. I got all my sisters with me. We are family. Get up, everybody, and sing. Everyone can see we're together as we walk on by. And we fly just like birds of a feather. I won't tell no lie. All of the people around us, they say, can they be that close? Just let me stay for the record. We're giving love in a family dollhouse. We are family. Hey, 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 oh. I got all my sisters with me. Hey, hey, hey. We are family. I got my sisters with me. Get up, everybody, and sing. Hey, 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 oh. We are family. Get up now. I got all my sisters with me. I got my sisters with me. We are family. Have faith in you and the things you do.
COVID-19 is unlike any health threat Africa has ever faced. Unlike other epidemics, it's threatening all the countries on the continent at the same time. It's also threatening progress with other diseases because of the challenges in providing prevention and treatment services to people during the pandemic.
We implemented bold and stringent measures, including immediate closure of borders as soon as the first cases were detected. The assistance of the WHO was instrumental throughout.
A OMS integrou desde o início a equipe nacional de intervenção rápida, elemento importante que ajudou para não só aqui na cidade da Praia, em Santiago, mas em outras ilhas.
The whole policy of preventing this disease, starting by preventive measures. All of these measures were implemented as recommended by the WHO. They supported us in setting a strong surveillance system.
The training we did with the WHO.
Comme la dernière ligne sur laquelle l'humanité compte, nous avons suffisamment des agents qui se sont dit, malgré les conditions, malgré les difficultés, nous nous mettons pour protéger la race humaine.
It's coming at the right time because we'd like to get the health workers up and running.
We make them aware and they be alert. If they see any sign or symptom about any disease, we help them, maybe refer them to any nearby health facility.
Nous nous assurons que tous les passagers qui se présentent puissent avoir le test COVID négatif.
While fighting COVID-19, WHO has also been in the Democratic Republic of the Congo to control its 11th Ebola outbreak, which has now been declared over.
When I came, they've been observing social distance. We use this water and liquid soap and then sanitizers around, so I feel safe to come to the hospital.
In the past 9 months, through working together, we've come a really long way. But COVID-19 remains a threat. It's tempting to let our guard down, but we must fight the fatigue. Stop before you go out. Put on that mask. Put it on correctly. Keep your physical distance to the extent possible and wash your hands frequently. These small acts can stop one of the biggest health threats of our generation.
we're together as we walk on by. And we fly just like birds of a feather. I won't tell no lie. All of the people around us, they say, can they be that close? Just let me stay for the record. We're giving love in a family dollhouse. We are family. Hey, I got all my sisters with me. Hey, we are family. I got my sisters with me. Yeah, everybody is saying, hey, 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 we are family. Get up now. I got all my sisters with me. I got my sisters with me. We are family. Heavy than you and the things you do.
COVID-19 is unlike any health threat Africa has ever faced. Unlike other epidemics, it's threatening all the countries on the continent at the same time. It's also threatening progress with other diseases because of the challenges in providing prevention and treatment services to people during the pandemic.
We implemented bold and stringent measures, including immediate closure of borders as soon as the first cases were detected. The assistance of the WHO was instrumental throughout.
A OMS integrou desde o início a equipe nacional de intervenção rápida, com um elemento importante que ajudou para não só aqui na cidade da Praia, em Santiago, mas em outras ilhas.
The whole policy of preventing this disease, starting by preventive measures. All of these measures were implemented as recommended by the WHO. They supported us in setting a strong surveillance system.
The training we did with the WHO, I can say it was an eye-opener for us.
Nous sommes la dernière ligne sur laquelle l'humanité compte. Nous avons suffisamment des agents qui se sont dit, malgré les conditions, malgré les difficultés, nous nous mettons pour protéger la race humaine.
It's coming at the right time because we'd like to get the health workers up and running.
We make them aware and they be alert. If they see any sign or symptom about any disease, we help them, maybe refer them to any nearby health facility.
Nous nous assurons que tous les passagers qui se présentent puissent avoir le test COVID négatif.
While fighting COVID-19, WHO has also been supporting the Democratic Republic of the Congo to control its 11th Ebola outbreak, which has now been declared over.
When I came, they've been observing social distance. We use water and liquid soap and then sanitizers around, so I feel safe to come to the hospital.
In the past 9 months, through working together, we've come a really long way. But COVID-19 remains a threat. It's tempting to let our guard down, but we must fight the fatigue. Stop before you go out. Put on that mask, put it on correctly, keep your physical distance to the extent possible, and wash your hands frequently. These small acts can stop one of the biggest health threats of our generation.
We are family. I got all my sisters with me. We are family. Get up everybody and sing. We are family. I got all my sisters with me. We are family. Get up everybody and sing. Everyone can see we're together as we walk on by. and we fly just like birds of a feather. I won't tell no lie. All of the people around us, they say, can they be that close? Just let me stay for the record. We're giving love in a family dollhouse. We are family. Hey, 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 oh. I got all my sisters with me. Hey, hey, hey. We are family. I got my sisters with me. Get up, everybody, and sing. Hey, 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 oh. We are family. Get up now. I got all my sisters with me. I got my sisters with me. We are family. Have faith in you and the things you do.
COVID-19 is unlike any health threat Africa has ever faced. Unlike other epidemics, it's threatening all the countries on the continent at the same time. It's also threatening progress with other diseases because of the challenges in providing prevention and treatment services to people during the pandemic.
We implemented bold and stringent measures, including immediate closure of borders as soon as the first cases were detected. The assistance of the WHO was instrumental throughout.
Remercie logo desde o início a equipe nacional de intervenção rápida, com um elemento importante que ajudou para não só aqui na cidade da Praia, em Santiago, mas em outras ilhas.
The whole policy of preventing this disease, starting by preventive measures, all measures were implemented as recommended by the WHO. They supported us in setting a strong surveillance system.
The training we did with the WHO, I can say it was an eye-opener for us.
Nous sommes la dernière ligne sur laquelle l'humanité compte. Nous avons suffisamment des agents qui se sont dit, malgré les conditions, malgré les difficultés, nous nous mettons pour protéger la race humaine.
It's coming at the right time because we'd like to get the health workers up and running.
We make them aware and they be alert. If they see any sign or symptom about any disease, we help them, maybe refer them to any nearby health facility.
Nous nous assurons que tous les passagers qui se présentent puissent avoir le test COVID négatif.
While fighting COVID-19, WHO has also been supporting the Democratic Republic of the Congo to control its 11th Ebola outbreak, which has now been declared over.
When I came, they've been observing social distance, water and liquid soap, and then sanitizers around, so I feel safe to come to the hospital.
In the past 9 months, through working together, we've come a really long way. But COVID-19 remains a threat. It's tempting to let our guard down, but we must fight the fatigue. Stop before you go out. Put on that mask, put it on correctly, keep your physical distance to the extent possible, and wash your hands frequently. These small acts can stop one of the biggest health threats of our generation.
Thank you very much. Honorable Ministers, distinguished delegates, we are about to resume the session. Honorable Ministers, distinguished delegates, we are going to resume the session. Honorable Minister from Ethiopia, the floor is now yours. Thank you very much.
Thank you very much. Thank you very much, Pamela. Distinguished delegates and guests, welcome back. I hope you are all back from the break to resume the next session. The next 2.5 hours will be dedicated to a special session on the COVID-19 response in the WHO Africa region, in continuation of the session that we had in August. As we are all too aware, the COVID-19 pandemic has had heavy toll on lives, livelihoods, and societies globally. To date, the majority of African countries have succeeded in containing widespread community transmission, and I wish to take this opportunity to congratulate member states on your commendable leadership in the response to COVID-19. We all agree strong leadership is the cornerstone of an effective country response. Nevertheless, more than 1.4 million cases of COVID-19 and more than 32,000 deaths have been reported to WHO from the African region. It is thereby critical that all countries remain vigilant, and I am sure you all agree with me that there can be no place for complacency as long as the virus is still with us and continues to circulate. We all need to continue to be vigilant in our testing, isolation, and treatment, in our strong communication on the non-pharmaceutical interventions, the interventions we now have, the only interventions we now have at hand, and ensure we have the continued political leadership at highest level, leading the whole of government and the whole of society approach, while we continue our socio-economic activities to minimize the indirect impacts of the epidemic. We also need to make sure to identify key lessons to help us build a resilient health system going forward. Today, we will learn from this special session on the latest epidemiological situation in the African region, as well as lessons that can perhaps be replicated in other countries from South Africa's experience to date in curbing the spread of the virus. Finally, we will also receive the latest information available on the COVAX facility, which is a very encouraging progress globally to ensure that once vaccine is approved, it is available equitably to all countries here in the African region. The COVID-19 pandemic is a crisis unlike anything any of us have experienced in our lifetimes. However, it can be a catalyst for building a healthier, safer, fairer, and more sustainable Africa we all want. With this brief introduction, I am now pleased to invite the Regional Director, Dr. Moeti, to make the opening remarks for this special event. Dr. Moeti, the floor is yours, please.
Thank you very much, Honorable Minister of Health of Ethiopia, Minister Leah. Honorable Ministers, thank you and welcome back to our session, and particularly to this very important discussion on the COVID-19 pandemic. Indeed, it's already been said, it has been and continues to be a uniquely challenging experience. And I would like to reiterate what I said this morning and just repeat what the Minister said in her introductory remarks, that the response of the African region has been remarkable. And we are happy that some of the gloomy predictions that were made by many in the global health world, including by ourselves in WHO, did not come to pass. I think it was said that very early, very strongly, national leaders reacted to the threat. And it's been proven, some of the comments that have been made about the difficulties that countries that would normally have better capacity than we have in the region as compared to Africa has been the speed with which some of the strong measures were taken. And we acknowledge that they were taken at great cost. And again, the chair said there has been a huge socioeconomic impact. We are hearing countries being predicted to lose quite significant growth economically. We have seen schools closing. We have seen businesses stopping to do their work. But the numbers of deaths and the numbers of cases and the overwhelming impact on our health systems that had been predicted did not happen. So I'd just like to emphasize that the wisdom, the courage, the leadership was there. Now we have to gain from the heavy cost of these strong measures. in ensuring that we do not get the uptick that we are concerned we might get. Because frankly, we have seen people are tired, and people are tired the world over. So that emphasis on encouraging rethinking our strategies is very important. However, we do have hope in science having produced several vaccines that are extremely promising. And our duty as WHO in supporting you, in mobilizing partnerships, is to make sure that our region is not left behind, that we are not at the back of the queue as the world starts to obtain supplies and to deploy the vaccine. So the presentations that we are going to be making today are to gain an understanding of what has happened in our region, what are some of the lessons that we can take forward into the future in making sure that our systems after this pandemic are stronger than they were before the pandemic. That's one of the gains. What are some of the things that are being done which we can leverage for our health development more broadly? I'm quite certain that from the experience of South Africa, which is the country that has been most severely affected on the African continent, we can learn a lot. We can learn about how a middle-income country has had to strive, what they've had to do. And we can see parallels with your own countries. And we look forward very much to the sharing in the discussion of what you have done, which we may not have been able to document in WHO, because our role is to take it forward for learning into the future. So I'd just like, again, to commend your leadership, through you, the heads of state, the governments, the people, the healthcare workers, those who have even sacrificed their lives in this fight. And just to assure you, we are here in WHO to support everything that we need to do. And now we must gear up for the vaccine, get it out there so that life can be restored to normal and our economies can start to recover. Thank you very much, Minister Leah.
Thank you very much, Dr. Moeti, for your remarks. We will now move to part 2 of this special event, which provides a situational analysis on the COVID-19 pandemic within the region. I will pass the floor to Dr. Zabulon Yoti, the EPR Director in AFRO, to provide us a regional overview of the COVID-19 in the region. Dr. Yoti, over to you, please.
Thank you, Chair, Honorable Ministers, distinguished delegates, partners, and colleagues. On behalf of the Secretariat, I have the privilege to talk briefly about the regional overview as far as COVID-19 is concerned. But before I go to that, I would just like to highlight the priorities which the chair at the beginning of the meeting pointed out from the first phase, part of the regional committee: continued political engagement, information sharing within and across the countries, intensifying research on traditional medicines, preparing for the potential vaccines, to access them, to make sure that the vaccines are part of the response, and lastly, the strong community engagement and active participation of the key partners. So with that, I am going to take about 15 minutes going through a few slides. And I'll be talking about briefly epidemiological situation and try to explain why this pattern of transmission as we observe, and then raise some expectations moving forward, which will allow us to have fruitful discussions. So going to the big picture, the global picture, we are already seeing the resurgence. In fact, from October, as you see on the trends on your right, globally, we have seen this sharp upwards trend after some slowing from around July. And in a day, now we are able to see over 600 new confirmed cases. And this shows that COVID is still a big public health problem, including over 11,000 deaths within 24 hours. So it kills as well. Of these new cases over 24 hours, Africa contributes significantly to those numbers, accounting for about 1.2% of new global cases and 1.4% of the deaths. That's if you just take a snapshot of 24 hours. I took this from the data of 22nd, 2 days ago. You have seen cumulatively, we have now exceeded 57 million confirmed cases globally, with over 1.3 million deaths. And of these cumulative numbers, the African region, which is our 47 countries, account for 2.5% of the cases and 2.4% of these cumulative deaths. Of interest, which I would like you to pay attention to, is the lower part of the trends by region. The resurgency we are seeing seems to occur in almost all regions. It's not uniform, but more pronounced. You've seen it in Europe. You've seen it in the Eastern Mediterranean region, while America's numbers have remained high with increases in the since October. So this resurgence, the so-called second wave, is real. So that's why it is really, we are privileged that we are able to have this discussion again in the second part of this regional committee. Next slide, please. So looking at the African region, 1.4 million cases and 32,000 deaths reported from all the 47 countries. And you have seen the trend that there was a rapid increase in number of cases until around July. And then with the concerted efforts, non-pharmaceutical public health measures put in place, some very stringent, were able to drastically reduce this number to a level which allowed us to organize ourselves in terms of putting capacities in place. Here, I really must thank all of you, honorable ministers, and the leadership of the countries for having made this possible. All the projections we had were not exactly this. They were worse than this. We were able to achieve better results in the region. However, we are concerned that there has been some plateau. And after this plateau, we are surely observing upwards trend now. Slowly, but it keeps going upwards. So we are concerned about that. And I hope with the fruitful discussions today, we'll be able to get some more priorities. Next slide, please. Looking at the absolute numbers, this slide shows the top 10 countries in the last 4 weeks. 4 weeks is twice the incubation period, maximum incubation period. We are still seeing a significant number of cases reported from South Africa, of late Kenya, Algeria, Ethiopia, Uganda, Angola, Nigeria, Botswana, Mozambique, and Ghana. However, I must state here that this considers these are numbers from the total population. If we look at attack rates, even smaller countries are more affected than this, like Cape Verde and so on would be high on this graph. The top 10 countries in the last 4 weeks accounting for 93% of all deaths include almost the same countries which are reporting these higher numbers, apart from DRC, Zimbabwe, Nigeria, and Mozambique. Next slide, please. Looking at the transmission dynamics, the situation actually varies from country to country. Even in the same country, you see variations from district to district. At the local level, there may be clusters. In another district, there may be sporadic cases, while other districts have intense transmission, giving us the impression that, yeah, there's a reduction, but when you go to local levels where there is intense transmission, you need to adapt strategies towards responding in that particular context. So the risk remains high in the African region and globally, as I stated before, with 21 member states reporting an increase in the cases in the last 4 weeks. And we have consistently seen that the age groups most affected are between 20 and 49. But of course, this may reflect the general age group on the continent. What I need to point out here clearly is, although the morbidity is more in this age group, the mortality is more in the age group over 60 and related to comorbidities like diabetes, hypertension, and other chronic diseases as well. Happy to note that 4 countries which were at some different stages and some were already having community transmission, intense community transmission, have moved towards sporadic and clusters. So this gives us a hope that even if you see intense transmission with the current measures, you can reduce actually the number of cases and deaths. Rwanda has shown that, Eritrea and Mauritius. Of concern share is the health worker infections, which remain really problematic, knowing that healthcare workers are pivotal in a response to COVID, but also in providing other essential health services. So about 1,200 cases reported in the last 4 weeks. Next slide, please. I would like to just have one slide to talk about the pattern of transmission. There are some differences in socioeconomic factors driving variations in transmission across all the 47 member states. There are those which are associated with people congregation factors, which facilitate really the close contact of people and therefore transmission. This we are trying to measure by population density, by proportion of persons living in slums and urbanized population. And here you rightly adopted strategies to limit mass gatherings. During rallies, in the beginning of this meeting, political rallies were cited as one of the possibilities which facilitates this. Churches, funerals, and those gatherings. There are also environmental factors which facilitate longer virus viability in the environment. And here, social distancing, limiting activities has helped us to improve on the response. And then mobility factors, of course, those that facilitate movement of the population, including people who are asymptomatic, therefore are able to transmit the infection. And here, we tried our best to reduce the unnecessary travel and of course implemented things like lockdowns. And then of course sanitation factors where we're really talking about hand washing and sanitization and then use of masks. So these are some of the factors if we address and if we continue to enforce, especially use of masks and social distancing, we'll be able to achieve better results. Next slide, please. So what do we expect moving forward? There are some implications I would like to highlight. What we have seen is there's still smoldering pandemic in this region. Therefore, cases and deaths are still present and increasing in some areas. Much as the population is fatigued, the COVID-19 is not. Therefore, we need to continue to sustain COVID surveillance and control as part of the new norm. And then we, of course, need to focus and monitor effects on other essential services. We still have our usual diseases of malaria, measles, we have maternal child health. We need to continue providing those. And of course, protect the health workers from getting infected so that they're able to provide services. There's need to align public health response to current realities. Therefore, better emphasis on data and monitoring capacity, analyzing data at the local level and adjusting the response according to what the data is telling us. This includes sharing, of course, information across the region, within the countries and in between countries and harmonizing our responses. We are looking forward to vaccine readiness. We'll have a separate discussion on this. Vaccines have unique logistical challenges. You will hear later. We need to be prepared for that. So at policy level, these are the implications we will have to continue looking at. Next slide, please. We've made a few proposals. Most of them are not new. We're just talking about reinforcing really some of these as we prepare for possible resurgence. which other countries are already seeing, assessing the risk and rapidly adapting and implementing necessary measures at appropriate scale so that we both address the COVID-19 transmission and also look at the socioeconomic and public and social impacts of this disease, so that our measures put in place do not very much interfere with those other impacts. It's not easy, but that's what we are requesting that we continue doing. Secondly, creating ways of better involving the public. Every setting, such as the schools, villages, communities, we have done this before, honorable ministers, for other diseases where communities take leadership, ownership, active participation. We need to engage people as part of the solution and also explain to them why we're putting measures in place so that they continue to respect the measures and adapt them as part of the new norm. Managing rumors, information and misinformation remains very key as we move forward. Lastly, I would like to hint on expanding testing. If we need to know where the disease is, we need to have good surveillance, but also support it by testing, by not only focusing on travelers, but making sure that we also address the issue of contacts, the suspected cases, and then we are able to use the resources for both the travelers and those who are at risk of COVID. In that line, our collaboration with the Africa CDC and our teams here have produced some guidelines sent to the countries on the use of rapid diagnostic tests. And of course, you have placed some orders for use of that so that we are able to expand testing and have better mapping of the disease. I think with that, next slide, I would like to thank you very much and thanks for listening to this overview. Over to you, Madam Chair.
Thank you very much, Dr. Yoti, for taking us through the update and also highlighting the focus areas that we need to work on going forward. I will now pass the floor to the Honorable Minister of Health of South Africa, Dr. Mokize, who will inform us on lessons South Africa has learned to date from the COVID-19 pandemic that could be replicated in other countries. Honorable Minister, the floor is yours.
Thank you very much, Chairperson Minister Kapramedin Liat Dese, the Regional Director, Dr. Mweti, Excellencies, Honorable Ministers, and members of our WHO AFRO region. I'd like to table the journey of South Africa in response to the COVID-19, and we've got slides which I'm sure would be available to all the honorable colleagues. May I have the next slide, please? We would like to walk through a quick snapshot on the epidemiological picture, as well as go through certain lessons, whole of government response, risk-adjusted strategy, data-driven planning and focus, public-private collaboration, scaling up testing, community screening and testing, economic interventions, consideration for international travels, health systems preparedness and use of digital applications, and then of course a plan of action to respond, mitigate and respond to a resurgence, and then conclude. Next slide, please. Next slide, please. As we speak now, South Africa has about 769,759 cases, of which last 24 hours has given us 2,081 positive cases. The recovery rate has gone up to 92.8%, and our case fatality rate at this point is at 2.7%, and that is at 20,975. If we look at the picture, we will notice that there's a provincial variation. Each sub-national area has got its own dynamics that give us different figures. So Gauteng, KwaZulu-Natal, Western Cape, those are different provinces. You'll see that the distribution is not the same, and it's linked very much to economic activity and population density. Those are the two key issues. And if you look at those provinces in terms of their GDP contribution into the country, exactly it follows that particular pattern as well. Thank you. Let's move to the next slide, please. So this is the picture of how our trends of cumulative and daily cases. Our biggest thrust of the pandemic was the surge which happened in the middle of July. And then it started easing down right up till the beginning of September. And that's where we've started seeing a kind of plateau. But that pattern has been like that. But inside the country, the different provinces have had peaks at different times, and it doesn't follow the pattern that is seen on the earlier slide. But one province started, and then the others went and surged beyond it, and so on. So there's quite a variation on how the surge has been happening at sub-national level. Next slide, please. The pattern of the deaths has been also tracking, as you can see. What we normally then do at this point, we started not only recording COVID-associated deaths as they were reported in the hospital, but we then started also encouraging posthumous or post-mortem swabs so that we can test if people who died in an unexplained fashion could be COVID. And then there's also a modeling which has been done by Medical Research Council to track what we look at as other causes of death, which we call excess deaths. And the pattern, you can see that there's a particular pressure that's come from COVID-19 as a cause of death. Next slide, please. This is the journey. If we look through from March, that's when our first case was reported. And then there's a point at which we started a few weeks, about 2 weeks or so after the first case, seeing the numbers, the way they were increasing, doubling every second day. We started putting up, the president announced travel ban, school closure, and limiting gatherings. And then the numbers increased, but soon thereafter started picking up the deaths. Then we started putting up lockdown, and the first lockdown went in for about 5 weeks. And then at the time, just before that lockdown, we started a community-wide screening program to establish how wide is the problem of the infection. And then, of course, once we finished the community screening, we were able to identify hotspots and low transmission areas. We had what we call risk-adjusted easing of the lockdown. So we moved a step lower, easing the lockdown to a slightly lower level, but still the numbers were still going up, as you will see on the picture. We continued to ease the lockdown. This was mainly because the lockdown was to create ability to prepare our health facilities to accommodate large numbers of people who had not been part of our normal patient load on the previous years. We then ended up having to put up hospital beds, filled hospitals, bought ventilators, employed more staff. And then when we thought we were ready, we then moved to a next level of easing to a lower level. But you'll notice that we did that while the numbers were still pushing up. And so by the time we were looking at the third level risk-adjusted reduction of the restrictions, we're already rising to about 30,000 positive cases. The numbers went further up to about 60,000 cases, but then we then started bringing in at that point restrictions on alcohol, banning alcohol, no sale of alcohol. Already the meetings had been stopped, and large gatherings and so on. And earlier on, we had put up stopping inter-provincial traveling, but we had eased it off at this point. And then we then opened up the schools, even though the numbers were still high. In fact, it was based on the fact that the children are not really very heavily affected by COVID-19. Of course, we had an issue with the teachers and all the other sectors of economy had opened. but we continued at that level until we saw inflection of the curve and things started easing with numbers beginning to reduce, although the cumulative numbers were going up, but nevertheless the daily numbers were starting to show a decrease. Then we moved to level 1. At this point, we have what we call the level 1 restriction, which is only leaving the kind of restriction that we need to contain COVID-19, which we are not likely to change for quite a while now until we get the vaccine. So by that 3rd of October, we've done 4 million tests. 4 million tests had been done just to be able to see what is the level of cumulative number, cumulative cases. Next slide, please. Next slide, please. This indicates the structure. The COVID-19 response was led from the top, which was mainly led by the president, and then created a committee of ministers, which was called National Coronavirus Command Council. That is where the Minister of Health would report to. Then all the provincial leaders of health, the Ministerial Advisory Committee, internal project management units, and internal case management task teams, the laboratories, everyone on the right of the slide would report to the Minister of Health. But from the different departments, the president created an interdepartmental team which involved a number of heads of departments. Those constituted what was called NetJoc, which basically meant that it's where the top leadership would take decisions that amalgamate what comes from the provinces, what comes from the different departments, and therefore make recommendations that would be considered by the Coronavirus Command Council. This was cascaded to the provinces, and each province had to do the same, and each district council had to do exactly the same. So, and in the process, it then started involving a whole lot of other stakeholders, the labor, the business, community leaders, and so on. All of that basically we're now working through and fitting into these structures for decisions to be taken at a higher level. Next slide. From the point of view of the health side, the incident management team was focusing meticulously on issues of effective governance and leadership on the health sector, strengthening surveillance, strategic information, augmenting health systems readiness, enhancing community engagement, improving laboratory capacity, and scaling up infection prevention control measures, boosting capacity at the ports, and also bringing the issue of therapeutics, diagnostics, and vaccine. All of that was taking place going through this incident management team. Next slide, please. Next slide, please. This risk-adjusted strategy, these different levels that we had put up, basically we divided the response into various ways. It had to take into account the level of the spread of the infection and the risk that we could identify at that time, together with the readiness of the hospitals and what needs to be done on the community. So level 5 was the highest lockdown. Here, nothing moves. No roads, no cars in the road, no movement out of the house. Everybody stayed indoors. This was the one that was quite heavy. And then, of course, after that, we started releasing certain economic activities to continue. And then, of course, we started opening up workplaces and preparing people for more containment measures during their workplaces. And then we moved on to insist on the physical distancing and so on. So these are the levels. At this point, this is the last level, which is the closest to normal as possible, which is alert level 1. Next slide, please. We had a lot of criticism with that. There were those who were saying, just let go of this whole restriction, but we felt that we wanted to ensure that there was no rebound response of the pandemic as a result of recklessness in the way that we'd released. Then there was another very important pillar, which was data-driven planning and focusing. Here we had put together all the modelers in the country into a consortium, and this consortium created what they call the South Africa AP model. They then modeled on the active cases, when to expect the surge, what numbers do we expect, and which provinces are likely to be more affected. Then they went on to look at the hospital beds that are needed and modeled those up, and then we started scaling all our investment to match up the hospital beds that are needed, that also came together with the numbers of staff that would be needed, ICU beds that are needed, number of ventilators that are going to be needed, and also started matching up on the cumulative deaths. What ultimately we were, when we got to a peak, we were at about 13,000 positive tests in a day. But what we had found in this process is that firstly, the models were very inaccurate at the beginning because they were based on models from all over the world. They were not specific to South Africa. But later, as the information became more and more refined, they became more useful. But we were able to notice that the surge was still predicted almost at the same time. But we noticed as well that our surge wasn't coming as high as was originally predicted on the model. So all the numbers now, ICU beds, hospital beds, and deaths actually were actually ultimately less than what was on the models. Next slide. But the models were very helpful because then you could then take clear policy decisions at that kind of level. The next one was the issue of the collaboration with the private sector. We found it quite important to work together here as private sector to provide a seamless service. So we had agreements at private hospital levels as to how we would spill over to the other when there's a need. Then we had instances, we also had agreement with the laboratories that all the laboratories will operate under the National Institute for Center of Disease Control in the country. And therefore, when we give the reports, it covers everyone, and all of them had to align themselves in terms of the reporting protocols. At this point, we have actually got about 5.3 million tests that have been done. As much of them have been done in the private sector and of course in the public sector. We had agreed on the use of the ICU beds and so on. So this basically made it very clear that we cannot work without ensuring that public and private sector are aligned so that people get the services. Wherever they enter the service, they should find the same kind of service. So the protocols for treatment were now standardized across public and private, and there was close collaboration at that level. Next slide, please. Then the issue that was also very important was the need to scale up testing capacity in two ways. In the first instance, we had to go up and do community screening, and therefore we needed to test as many people as possible just to be able to see where the hotspots are and where the low transmission areas are. But as the numbers increased, it became important for us to increase the numbers of tests that we were able to do. So we increased the capacity from 5,000 to 15,000 tests within a 2-month period. Our biggest challenge then became the availability of kits, because most of the countries that supplied us started hoarding this for themselves. The banning of international travel meant even the cargo was actually getting affected, and this did create a challenge. But over a period with various channels, we were able to push up the testing to close to 50,000, where we got the maximum number that was possible for the country, which was now useful to be able to make sure that we net in as many people as possible within the testing capacity. At this point, because of the surge having gone down, we're testing around 25,000 per day, and this is really based on the criteria. We have to keep changing this criteria to net the maximum possible number of people that are positive to get the test. Then at this point now, we have to look at how to roll out the antigen testing capacity, particularly the ports of entry, and also to focus on the areas where there are cluster outbreaks that are already being seen, so that we can actually identify hotspots like university students going to parties. Then if there's a cluster outbreak, and then you get factories, or you get old age homes and prisons and so on. So we have to focus on those areas with increased testing capacity. Next slide. Sorry about that interruption. The community screening and testing, we dealt with this as another strategy, where we went to passive screening testing strategy, screening international travelers and tracking all those who have had exposure, and then enhanced our screening to ensure that we establish call centers where there's public to report symptoms and so on. And active screening where they redefined testing strategy to increase the case detection. So we had to keep changing the strategy to suit the situation in which we are. Next slide, please. On the community screening, it was quite a huge campaign. We actually rolled out over 60,000 community health workers to go out in the community just to find the symptoms, and anyone who's got symptoms had to be tested. And out of that, we were able to screen for symptoms 28 million people. And out of that, we were able to put up a map that showed us the areas of high transmission, the areas of low transmissions, the areas of low risk. And this was really quite helpful. And after we've done this, we then changed and focused now on a hotspot strategy. That strategy was to say, what do we do in the areas where there's high transmission, and how do we keep the others which are low transmission to be to have a high vigilance monitoring, so that when the numbers change, we're able to look at that. That helped quite a lot, because when we opened up, as we say, the risk-adjusted strategy, we ended up having to get people to go back to the mining operations, and then it started showing us where the flare-ups were coming. People came from a high risk area, they got into the area where there was a mine, and all of a sudden you started seeing the numbers increasing, mainly because of this strategy. Next slide, please. And of course, all of those people were dealt with through isolation, quarantine, and so on. The other issue, which was a major consideration here, was the issue of economic interventions. The first problem here is that once the economy ground to almost a halt, that meant that there was no income, there was no food, so there was hunger, there was unemployment, and that became quite a big issue. So the government had to announce a package where resources had to be made available to help businesses that had lost income, to help businesses to reactivate their activities so that they can start opening up. As each sector was opening up, they needed to be able to approach the banks to get rescheduling of debts, rescheduling of their monthly obligations, and that was covered with this particular package. And in addition, small businesses had to also be given their own package to assist small businesses, because once we said there was no movement, it meant that informal traders on the streets were completely vanished. Now they needed to be assisted to come back. So that was another area. Then we had to deal with people who were unemployed because of closure, and those who were unemployed because they had never been employed before. So then a whole special package was put up that has actually netted probably about 8 million people who have had to benefit out of that. Then there was a problem of the indigent who were receiving grants from government, the elderly, the disabled. So this had to be increased now, so that to cater for the fact that there was increased starvation and so on, and that was actually increased at that level. So this whole package was basically to begin to reactivate not only the lives, but also the livelihood had to be taken care of. So I think it's important for us to be able to see that on the one side, we had to deal with economic crisis, on the other side, we had to deal with humanitarian crisis. And these together had actually manifested in the community with increasing crime, increasing gender-based violence, and that was a result of all of this crisis that was going on in the community. So the packages were put into this, and the whole budget was redone so that more resources were mobilized to go and assist the health department to put up infrastructure, human resources, and equipment that was needed to up the game and respond to the COVID-19. Next slide, please. So the issues that relate to international travels, basically, we had to stop international travel, and then, of course, did the screening. We having put the National Disaster Act in operation, where to increase those who are coming to the point of entry. With changes now to the alert level that we are in, we're now focusing on screening for all international, interprovincial, and international travel, using 72-hour PCR negative PCR test for those who are coming into South Africa, and then intensify the screening for travelers without a negative PCR. We also insist on the issue of the 10-day quarantine for those who are coming in, except if there's specific special arrangements that are involved, like, for example, those who are working across the borders, those involved in logistics, truck drivers, and so on, there's special dispensation to allow those kinds of situations. Next slide, please. Then, of course, when we're to deal with the issue of health facility preparedness, what was important was the field hospital beds, oxygen, to have high-flow oxygen, nasal oxygen, meant that hospitals that didn't have oxygen tanks had to be set up, and then were to increase the oxygen availability throughout all the hospitals as a first line of intervention. Then we increased the ventilation capacity. I must say that both ventilation and ICU, even the field hospital bed, during the peak, we didn't actually breach that, so we performed less than what we had provided for, which for us was giving a degree of comfort. And then, of course, we had to hold some of the routine medical services and then prepare for the surge. And these were some of the lessons learned, that in halting routine services, we had the impact on non-communicable diseases, diabetes, as well, heart diseases, blood pressures. We also had, a reversal on some of the basic immunizations and, treatment testing for TB, HIV, and so on. So we do need to keep that balance so that we don't lose patients from another cause of ailment. Next slide, please. This is just an example of the IT that we're to use for informing people of their results. There's one, COVID Connect, is linked to the laboratory results. So it asks you questions and you respond, and then it screens you for symptoms and then refers you to a nearby testing area. The COVID Alert is the one which you download the app, and then it tests. If there's anyone who's downloaded and has tested positive, it will warn you that you've been exposed to a COVID positive person, could have been infected. So please do testing. Thank you very much. Next slide, please. Let's move to the next slide, please. There is now the issue of resurgence, and we've taken lessons from various countries, and led by WHO, we've started working on building this resurgence, and I want to thank WHO for the reinforcement. They brought up a team to help us with every province to be able to do interaction reviews. We've now got all provinces with each one with a response plan, and also going down to the district and sub-district level. Next slide, please. This focuses on early detection. It also focuses on numbers of positive cases, numbers of death, admissions, and so on. And if it's under control, is when you see it's less than 10% of increase. If it's 10 to 20, then we see that we need to be alert. Once it starts going beyond 20, then we have to activate the resurgence plan. And it's important for us to continuously watch, even at various levels, because the clusters can grow into a large number. It may not be enough to show the whole district, but you need to act on those areas. We've seen, one area there will be a resurgence. It will be acted upon. It will come down. It will resurge in another area. But of late, there are areas now, one province that's beginning to show constant resurgence that is not really reducing, and we are giving attention to that. Next slide, please. So our conclusion is that we believe that a strengthened command and control was important, obtained through both centralized and decentralized incident management teams, and involvement all of government, and also participation of all other leaders in society. Secondly, swift evidence-based decision-making is impossible. Is important. In our case, this made it possible to carry along society, because the society out there, the media, people, they question every decision the government made. Now, if you needed to take a decision, you need to show society, yes, the basis for it, and then of course you have to go to court sometime to go and defend it and so on. But we made it through, and I think the issue of evidence-based decision-making makes everyone understand where we are. Then stringent lockdown provided us time to be able to increase capacity on the health side, and then timely implementation of technologically innovative methodologies is also important. Public-private sector collaboration, there was one structure which was called the Solidarity Fund, which basically got the private sector to put money together helping now to purchase PPEs, ventilators, community programs, and test kits, and also in vaccine. So private-public collaboration is important, both in terms of service and some of the initiatives that came along. Then the other issue is that whilst the stringent lockdown is helpful to reduce the spread of the infection, it results in economic hardships which need to be balanced, because the communities begin to get into COVID fatigue, and also they begin to disregard all the forms of restrictions that are supposed to be brought in place. Right now, we're going through this COVID fatigue, both from the point of view of community who are tired of wearing masks and distancing, and the youth who want to have their parties and all of that. On the other hand, we've got health workers who have been into a very heavy burden for the whole year, and now the resurgence is coming, and they're also showing a lot of fatigue. Those are the areas we need to continuously focus on. Then tracing, contact tracing is key. It's an important issue. Mass communication and screening was also useful to bring the awareness of the community, but also to help us to see the distribution of the infection in terms of hotspots and low transmission areas. Thank you very much. And next slide. I think this should be the end at this point. Let me say thank you very much. At this point, as we talk about the resurgence, we came down from a level of about 13,000 per day. We're now down to 2,000, but we're at 1,000 positive cases. We're now going up to 2,000. That's already saying to us these are new cases. So there is definitely new activity. As to what extent that will be contained, it's another question. We're concerned about the festive season. So with all of that, we want to just say that it's a learning curve that you only learn as you come across it. There's not much that we can, say about what we could have done better or not, but we learn as we dealt with the situation. And thank you very much for giving us the opportunity. I'm sorry it's taken long. Thank you very much.
Thank you very much, Honorable Minister Dr. Mkhize, for yet this another very informative presentation and sharing South Africa's experience. I hope we are all able to take note of many best practices that can be learned from South Africa's experience, from the strong coordination to all the specific interventions that the country has been taking to adapt to our respective countries. Thank you so much. I now pass the floor to Dr. Richard Mihigo, the Regional Vaccines Preventable Diseases Coordinator at WHO AFRO, who will provide us an update on COVID-19 vaccines, country readiness and delivery activities. Over to you.
Thank you very much, Honorable Minister, for giving me the floor. Honorable Minister, distinguished guests for the Regional Committee meeting, I would like to really take this opportunity to take you through, during the next 15 minutes or so, to provide an update on the COVID-19 country readiness and delivery activities as we all prepare for the advent of vaccines against COVID-19. So next slide. I would like to start, Honorable Minister, by just recalling this ACT Accelerator initiative. As you all are familiar, I'm sure, about this. As you remember, in April this year, WHO, working with the partner, launched this very important initiative, the Access to COVID-19 Tools Accelerator, to speed up the development, but also, more importantly, the delivery to countries of the different commodities that were very important in controlling this pandemic. So the ACT Accelerator has three major pillars: vaccines, therapeutics, and diagnostics. But I'm going really to focus during this presentation on the vaccines pillar, also known as COVAX, which has the ambition to bring, by the end of next year, 2 billion doses of vaccine to the member states. But also, as you know, for the therapeutics, there are a lot of work that are currently being done with the ambition of bringing close to 245 million courses of therapeutics by mid next year. And then finally, I think we heard during the first presentation by Dr. Yoti, also some efforts in trying to improve the diagnostics parts and supplying 500 million tests by mid-2021. What is more important with the ACT is that it includes also a health system connector, which is quite critical as we are going to talk on delivering of vaccines moving forward. Next slide. So during the last few months, we have seen a lot of progress with regards to country adhering to the COVAX facility, which is, as I said, the vaccine component of the COVAX facility. So far, there are close to 185 countries that have confirmed their adherence, their participation to the facility. These are divided in two groups. The self-financing countries that you can see on the red in this map, and the blue ones are the countries that are going, the group we call familiarly Advanced Market Commitment 92, who are going, group that are going to be subsidized in moving forward. But you can see a few dots in white on this, which are yet to make the final decision on that. And we are working with those countries to make sure that they can adhere to the COVAX as soon as possible. So for our continent, these are South Africa, Equatorial Guinea, and Gabon. Next slide. So I don't going to spend much time on this very quite complex slide, but I wanted just to let you know that we have seen an unprecedented speed, energy, and I think a global search for vaccines since the beginning of the pandemic. Hundreds of vaccines have been currently in the pipeline for vaccine development, and close to 50 now, 47 have already entered clinical development in human people. But what I want you just to look at is the last part on the phase 3, which is the last part of the clinical trial, where we have 10 vaccines which have entered this last phase of the clinical trial. And the last 2 or 3 weeks, we have seen quite a major acceleration with 3 of these 10 vaccines producing data on their efficacy. So we have highlighted in red those vaccines that are currently being supported by CEPI through the COVAX initiative. And I think these are 8 vaccines. And I think that is very important because this will have implications as we move forward in terms of engagement and making available the vaccine dose to our member states. On the next slide. So going a bit in detail with the data that we have seen coming up and the latest yesterday by the AstraZeneca, we have now the first vaccine efficacy results, both from the Pfizer and Moderna vaccines that are using a completely novel platform for the development, which is the messenger RNA. And yesterday we heard the latest data from AstraZeneca. There is a small typo there, is using the vector viral platform, not messenger RNA. But what is interesting really is the very high that these 3 vaccines have demonstrated. The first 2 with efficacy beyond 90%. And the most reassuring with the data we heard yesterday from the AstraZeneca, a pooled efficacy for the 2 different regimens that were in clinical trial of 70%. But also when we looked at the data and in one of the regimen also getting close to or 90% efficacy. So this is really a major development in such a very short period of time. With literally, with the data that have been published so far, no severe adverse events. And we are still looking at the follow-up on these patients who were under clinical trial. Next slide. Another interesting set of data that was released with these 3 vaccines was the ability to roll them and even to use them, particularly in our context in the African region. So when we looked at the cold chain requirements for these 3 products, the latest information that we released yesterday by AstraZeneca is quite reassuring because this vaccine can be stored on the normal temperature range that we are using usually in the EPI program, +2 up to +8 degrees, and that could be prolonged for a prolonged period of time. But for the 2 other vaccines that are using the messenger RNA platform, we have seen some of the issues that were raised, particularly with the first one, the vaccine by Pfizer and BioNTech, that needs ultra cold chain infrastructure to be stored up to -80. But this vaccine can also, once it has reached the level of implementation, at least be stored by +2, +8, up to 5 days. The Moderna vaccine can use what many of the current vaccine in the program are using, -20, like polio, measles vaccine, which is quite interesting. So some very interesting features, but also some limitation in terms of implication for rolling out of these vaccines, as we will see moving forward. And as this vaccine, the clinical trial were going, what is important to mention here, the manufacturing of the doses were actually done in parallel. And the 3 vaccines have already filled in the request for approval, at least for emergency use listing, 3 of them through the US FDA, European EMEA, but also WHO. Next slide. So COVAX facility has, since the beginning, tried to anticipate also. I think we have all followed the several deals that are currently being done by developed countries on a bilateral level with different vaccine manufacturers. So COVAX facility, which is pulling the demand from all the participant economy, have also tried to enter into agreement with some of these vaccine manufacturers. 3 deals have already been done. The first one directly with AstraZeneca and Oxford University with their vaccine, where we received data yesterday. A statement of intent have also been signed with Sanofi and GSK, which vaccine is still at phase 2. But also interestingly, a deal has been signed with Serum Institute of India that is going to produce the vaccine on behalf of AstraZeneca and Novavax, which is another vaccine that is almost at the end of the clinical trial. And the supply that has been secured are 200 million of doses with Serum Institute of India, and with the option of additional dose from the AstraZeneca and Novavax. And these 200 million have been secured for AMC 92 economy. A separate deal was done with AstraZeneca for 300 million doses, but these 300 million of doses are for all 87 AMC countries. And then finally, with Sanofi and GSK, a statement of intent has been also signed for 200 million doses of their vaccine, and that's for all economies. So far, close to 700 million doses has been made in terms of bilateral deals with these 3 manufacturers. Next slide. So on this small table, we have tried with the latest information we have received from Gavi and the COVAX Facility Secretariat to understand what could be the availability of the product in the current COVAX portfolio candidate vaccines. So if you can see, breaking down in terms of the different semester for quotas from next year, it is expected that the majority of the doses in the COVAX facility will come from the AstraZeneca. Hopefully, if everything goes well by the end of Q1. And there are currently discussions on how potentially less than 5% of the current deal could be done with Pfizer and BioNTech. But it will be interesting to get your feedback during this meeting, Honorable Minister, on what could potentially be your view and vision on the use of such a product. As we see time pass, we are going to see more and more vaccine coming in the pipeline, hopefully by the data for the Novavax vaccine, but also the other Sanofi. But this is not only the portfolio of vaccine in which, for the moment, the COVAX facility is currently in discussion. As new products are going to become and data available, we'll get more information on the deals that are currently being negotiated through the COVAX portfolio. Next slide. So on this slide, I wanted just to touch base on the pricing, because I think that will be a very important key element, particularly for countries that are going to self-purchase the vaccine themselves, because the price differential is quite important. So the first two vaccines that were out there, the vaccine using the messenger RNA platform, which is a novel technology. The information so far available are that these vaccines are going to be quite expensive. For the Pfizer and BioNTech, around $20, 19.5, and the Moderna vaccine between 32 to 37. So these are prices that are currently announced through press release in the media, but are not necessarily reflected the deals that could be obtained through negotiation in the COVAX facility. But when we looked at these two vaccines that are currently in the COVAX portfolio, and particularly the AstraZeneca, I think the price, predicted price is around $3 per dose. And we have heard yesterday the announcement by the Oxford University and AstraZeneca that this vaccine will be provided in the future for the same amount of price, and their intention was a non-profit aspect. For the other candidate vaccine that are out there, we've tried as much as we can with the limited information to also highlight the price that could be used. Next slide. So one important element, honorable ministers, I think will be the cost sharing that the country will be requested to put in. So two options here. First of all, the particularly for the AMC 92 supported countries, the donor-funded doses will help at least. This is what we call the fully subsidized doses to kind of jumpstart the introduction, with the intention to reach at least 20% of the AMC participant population. Indeed, this will depend on the vaccine development success. At least we have seen 3 vaccines that have published their efficacy data. But also the issue of pricing will be quite something important that will help the determine to which extent the COVAX facility will get to that ambition of at least securing 20% of AMC participant population doses for everybody. So for countries that are going to look at vaccinating beyond 20% of the population, so the cost sharing will then be used to top up actually that which are going to be supported by the COVAX facility. And countries have options to use either donor money, and we have seen quite some interest from the World Bank to support member states to co-share, to fund that additional vaccines that they may be requiring. But what is important for the participants that will not co-share, so will still receive at least their share of donor-funded doses. This is 20%, but obviously no additional doses is going to be provided to them. Next slide. So WHO has developed an allocation framework, and we have been currently in discussion with member states to see how this could factor in the preparedness activities that have already started in countries. And the goal, obviously, is to make sure that we protect public health, minimize societal and economic impact. And we have heard in the very nice presentation done by Honorable Minister from South Africa, how it could be challenging, really, not only beyond the health sector, also the impact of COVID in economy and livelihood of our population. So the objective really with this scarce number of doses that will be available is to see how country can prioritize some of the different groups to make sure that the dose become, whenever they become available, they can target the high priority group to make sure that we can keep our health system strong, but also our economy going forward. Next slide. So I would like to maybe finish this first part of the presentation by one important element that will come with this COVAX facility. We are currently in a very unprecedented time where the vaccine will start to be rolled out when we have no enough data in terms of their safety in a long run process, which we may call the issue of how are we going to deal with the issue of indemnification, liability, and potentially some compensation that could be filled in by people in case there are serious adverse events for those who are using those products. So the current discussion is that the vaccine manufacturers are currently requiring that all participants that are going to receive the vaccine to some extent adhere to this indemnification framework. So the lack of that process will be actually a limitation factor to the vaccine. But there are a lot of discussion going on for the moment, even through the COVAX facility, to make sure that the countries are not dealing with this issue alone, but to see how there could be a process by which through the COVAX facility, this could be facilitated. So COVAX is currently working to obtain what we call the Cooperation of International Development Law Organization, which will assist interested AMC country in respect with the above indemnification and liability issue. Next slide. So beyond the COVAX facility, it's important to mention also that the African Union have also, under the leadership of His Excellency President Cyril Ramaphosa, who's the chairperson of the African Union, also, as you know, the African Union have launched the vaccine financing strategy that is also trying to see how we can get to the goal of vaccinated around 60% of the population on the African continent to further stop the transmission of COVID. So it was estimated that it will be needed around $12 billion of dollars to reach that goal of vaccinating up to 60%. And the funding is expected to come through three major areas. The COVAX donor initiative that I've just explained, with at least securing 20% of the population but also the World Bank that has announced quite an interesting financial scheme. And more recently, the African Import-Export Bank have really mentioned these expectations to raise up to 5 billion to support this effort that is currently supported by the African Union. So recently there was the establishment of the COVID-19 African Vaccine Acquisition Task Team that is going to support member states to go beyond. And I'm glad to see the presence of Honorable Minister from South Africa that is playing a key role in this process. Next slide. So to conclude this presentation, Honorable Minister, what are we doing and what are we expecting country to do? So from the regional office under the leadership of Dr. Moeti, a regional task force has been put in place to support country to put in place the readiness and preparatory mechanism. So this regional task force is aimed to really coordinate the regional effort related to vaccine readiness and the delivery. It's a really a multi-stakeholder platform where WHO has pulled together all the partners currently involved in this to provide the necessary support to member states. Next slide. So we have come up using the polio geographic information system that have been quite efficient in dealing with polio, an online dashboard using the vaccine introduction and readiness assessment tool that I think you received a correspondence a couple of weeks ago from the regional director, Dr. Moeti, asking member states to fill that tool to assess the preparedness level of member states. So we are really very glad to report that the African region, compared to other regions in the world, has embraced this tool quite successfully. So far, we have 40 countries that are currently reporting their baseline assessment in this online tool. The readiness assessment tool has 10 major components that we are tracking the preparedness at country level for planning, resource mobilization, regulatory aspect to demand generation. On this map, this dashboard, we have highlighted, for instance, planning and coordination. And we can see that for the 40 countries where we have data, we have a 43% weighted readiness for only planning. But when we looked at all the different components of the readiness assessment tool, we are still having a lot to do. Only 33%, when we take a weighted readiness, we can say we are really far to be ready to deploy this vaccine. And most of our country are still on the activity at a very preliminary level. So I would like to seize really this opportunity to thank, first of all, member states, but also to call upon countries to work really with us to make sure that as we prepare for these vaccines, the logistics, the supply, and everything in preparing is also ready when the vaccine become available. Next slide. So, Honorable Minister, I would like to conclude this presentation by just putting in front of you few reflections that we are having here at the regional office, what we believe member states could do. First of all, I think it's important that we make sure that there is a national task force that is being built at country level. And this is not necessarily something that has to be done from new. I think the region has quite a lot of experience in rolling out a new vaccine, but we know very well that this vaccine will come up with specific challenges. This is why we believe that forming a group that will be responsible for putting all the planning issues together will be quite instrumental. It will be important that member states assign really a clear control and command role during this planning stage so that we ensure some accountability in the planning processes. and most importantly, to ensure that there is a multiple stakeholder participation, because we have seen that it will require definitely a whole of government approach to respond to this pandemic. Number two, we believe that after that, to develop a national plan will be quite very critical. As I said, we are still very far in terms of readiness, 33% weighted readiness so far. So we need absolutely to make sure that countries are building on the past experience in the introduction of other new vaccine, being Ebola, conjugate meningitis, polio, etc. It will be important that the identification and prioritization of target population be quite thorough. WHO have put forward, and we have sent those guidelines to countries. And it's important that the identification of priority group be data-driven to make sure that the people with the few doses that are going to become available at the beginning are really addressing the priority group using the data that are currently available. The supply chain and waste management need absolutely to be looked at quite critically. And we need to plan for the unexpected, not only for the cold chain, but also how are we going to deliver this vaccine up to very remote area. A very important element I believe we are currently seeing is this misinformation, and particularly what we've started to call infodemic management, to prepare the population, our community, for vaccine acceptance and uptake. Third, we believe that securing additional financing will be quite critical. As we have seen, the COVAX facility is going to provide resources for up to 20% of the population. But fortunately, there are many other new initiatives that are starting to emerge. And I believe it's quite critical that we start to work with countries to see how there could be the mobilization of additional resources to explore some public-private partnership that could help at least to address any financial gap that will emerge. And my last slide. Once we have gone through this journey of rigorous preparation, I think we need to make sure that we need to prepare the delivery now. These vaccines, some of them are going to come with a completely new technology platform on which they've been developed. So our regulatory processes to make sure that these vaccines are registered and ready to be used in our system will be critical. So WHO, working through AFRO, we are already started to work with your national regulatory authority to prepare them to be ready once this vaccine will become available, make sure that they can be registered safely in our country. To set up a very robust vaccine safety monitoring, I think that will be quite important. This will be novel products. And again, we have launched quite a robust system working with countries to improve the existing vaccine safety monitoring, but additional resources working with partners to make sure that any adverse event will be detected at time. The issue I refer to on indemnification and liability, I think we need absolutely to see how to focus on that. And as I said, this is currently being dealt in conjunction with the COVAX facility. And then finally, the needed infrastructure. So, Honorable Minister, I would like to conclude by saying that it will be important as many information are coming quite on a daily basis, and things are changing almost on a daily basis, to keep the line of communication open with not only the COVAX facility, and I think the regional director has pledged her support to member states to make sure that we are going to be there to provide any support that will be needed when it comes to the rolling out of this vaccine. It will be important that we ensure synergy between the African Union initiative through the African Vaccine Acquisition Task Team and the COVAX facility, and potentially to seek synergies while we are rolling out these new vaccines, to take that opportunity to revitalize the continuity of other essential health services. So I'd like to stop here, Honorable Minister, and thank you for your attention.
Thank you very much, Dr. Mihigo, for this very informative presentation and updating us on the current status of the new vaccines that have come out and that are on pipeline, and also for the very strong emphasis of the proactive role the countries need in terms of preparation for to be ready for when the vaccine becomes available. I think especially working on the different pillars that require our strong preparation. And I believe there will be many questions raised by the floor in relation to this COVAX facility portfolio, the preparations of countries, and how they will be distributed when they become available. So honorable ministers and delegates, the floor is now open for your comments and questions. And I will now call upon Mrs. Pamela Drame, who will kindly help me moderate this session. Pamela, over to you.
Thank you very much, Chair. With pleasure again. Honorable ministers, distinguished delegates, may we once again request that you raise your hand if you would like to take the floor. And to raise your hand, can you kindly click on the participants, participants, and then on the blue hand at the bottom right of the screen. So participants and the blue hand at the bottom right of the screen. Chair, I see the honorable delegate from Kenya, to be followed by the honorable delegate from Mauritania. Kenya, you have the floor.
Thank you, Chairperson. Kenya is pleased to participate in this AFRO Regional Committee meeting led up by our President. Kenya earlier on instituted mechanisms to coordinate preparedness and response efforts through a whole of government society approach. Based on the country's risk assessment, other measures were initiated that prioritized prompt case detection, infection prevention and control, risk communication, and community engagement. In addition, we enhanced surveillance for COVID-19 countrywide, including at all our points of entry, scale up diagnostic capacity, and increase local manufacture of essential items such as personal protective equipment, face masks, and hand sanitizers. Kenya is also prioritizing service provision for communicable and non-communicable diseases, mental health, mother and child health, and sexual and reproductive health, particularly for refugees and other vulnerable populations. To cushion our population from financial hardship, the government is implementing social and economic measures such as cash transfers, reduction of taxes, amongst other measures. As we move towards the next phase of the response, we urge the regional director to continue to uphold transparency and equity in the decision-making process and utilize the existing governance structures provided for in the WHO constitutions for greater ownership. In conclusion, Kenya takes this opportunity to reaffirm our support for the World Health Organization and its leadership in coordinating global health. 75 years since the establishment of the United Nations, Kenya firmly believes in the relevance of the multilateral system in providing the best environment for countries to jointly confront and seek for solutions for common challenges. Let us all endeavor to build trust amongst UN member states and in our institutions and create a safe, resilient future together. Thank you.
Thank you very much, Honorable Delegate of Kenya, Distinguished Delegate of Kenya, sorry. Mauritania, Distinguished Delegate of Mauritania, you have the floor.
Oui, bonjour.
Good afternoon. I would like to, on behalf of His Excellency, the Minister of Health, congratulate you for having organized this regional committee. It is also an opportunity to congratulate and thank Madam Regional Director, for the fabulous coordinating of all of this work since the beginning of the pandemic. However, I would like to signal that we have lost track a little in terms of communication, at least between the regional office and countries. It is an opportunity also to thank the local country offices who are collaborating very well amongst each other. So congratulations and thank you to them too. I would also like to commend my country for the work done, which has produced very good results. Although over 8,000 cases were registered, 109 deaths, and we have 389 currently active cases. I would like to congratulate Dr. Mihigo for his presentation. He raised a number of very important points. My concern pertains to this. I see that only 2 African countries can finance the vaccines, which is a pity. It shows how difficult it has been for our continent up until now to remain vigilant with regards to this pandemic, this large public health event. In some countries, vaccines are now beginning to be authorized. But now we're talking about the end of 2021, and I would like to ask that under the COVAX facility, Africa benefit from vaccines. We talk a lot about equity, but we must needs also talk about adequate sharing of these vaccines. We can't sit back and watch other continents get vaccinated, their populations vaccinated and ours not. So I would ask Madam Regional Director to do her utmost to guarantee that our African populations benefit as early as possible from these vaccines. The last issue has to do with vaccination as well. I see that the COVAX facility tends towards the AstraZeneca vaccine, 70% efficacy there, while the other vaccines are talking about 85, 95% efficacy, 94, 95% efficacy levels. But they appear not to be as popular to us. I'd like to know why. I know that the cold chain is very important, but we also look to efficacy as a factor. I would also like to understand, with regards to the COVAX facility, have the countries that have joined the facility got to finance part of the vaccines in order to be able to cover all their needs? Thank you.
Thank you very much, Honorable Delegate from Mauritania. I would now like to pass the floor on to Zambia. The Honorable Delegate of Zambia, to be followed by the Honorable Minister from Angola. From Zambia, you have the floor.
Thank you, Chairperson. Zambia continues to detect COVID-19 cases among various clusters in the community, including international travelers, truck drivers, patients presenting to health facilities, alerts, and contacts known to known cases. The Zambian government places high on its agenda the attainment of universal health coverage, using primary healthcare as a driver for provision of quality services across the continuum of care. Zambia's response to COVID-19 has taken an 8-pronged approach in line with the Africa CDC and WHO guidelines. The national response has taken a multi-sectoral, multidisciplinary complexion with coordination mechanism at both policy and technical levels. Various international and local stakeholders are supporting government in responding to COVID-19 through these governance structures at various levels. The cumulative numbers of cases as of today, 23rd November 2020, stands at 17,454, including 357 deaths and 16,707 recoveries. Of the deaths, 119 are classified as COVID-19 deaths, and the rest are COVID-19 associated deaths. We note with concern, however, the growing list of countries, including some on the African continent, that are reporting a second wave of infections. This upsurge follows a relaxation among members of the public in the observance of basic but impactful public health measures. Our region faces the very real prospects of a second wave, considering various challenges that still exist, including limited availability of medicines, consumables, reagents, and personal protective equipment, which are scarcely managed on our continent. The closure of many ports of entry and cancellation of most flights posed a challenge in transportation of goods. 2, inadequacies in health systems to ensure the continued provision of routine health services while supporting the clinical management of COVID-19 cases, timely contact tracing, laboratory testing, and adequate availability of emergency response commodities. To address this inadequacy of specialized medical facilities, Zambia devised a home-based isolation model supported by community volunteers for case follow-up and support. Number 3, inadequate healthcare staff to manage the pillars of the response. In the beginning, Zambia had to repurpose experienced staff from routine work in the health facilities. Zambia had the use of virtual learning platforms coupled with some limited in-person trainings help the country build appreciable skills in a sizable workforce for the response. We have opportunities to enhance our capacity to win the war against COVID-19. With concerted efforts among member countries and stakeholders, we could focus on the following. 1, build capacity on the continent to support manufacturing of medical supplies, PPEs, and some other equipment. Collaborative operational research to assume evidence for improved practice in pillars of the response. Number 3, vaccine development and participation in trials of other therapeutics. Number 4, information sharing and strengthened cross-border initiatives, including mandatory screening and testing with heightened infection prevention facilities at points of entry. Number 5, enhanced cross-border surveillance and screening activities. And finally, member states should intensify the enforcement of public health measures in country. In conclusion, COVID-19 may linger for some time, and as most countries ease restrictions while adjusting to a new normality, it is important to ensure that we attain a balance between essential life activities and observance of preventive health measures that protect us and those around us from exposure to infection. There is need for full participation and consistent cooperation of all member states and every member of our communities. I thank you.
Many thanks, distinguished delegate from Zambia. Honorable Minister of Angola, you have the floor.
Nos salutations à tous. Moi, je suis le secrétaire d'État.
Greetings to all. I am the PS in the Ministry of Health, and I am representing the Minister of Health of Angola, Dr. Sylvia Lutukuta, Regional Director, Dr. Marthe, Your Excellencies, the honorable members of the Ministers of Health of our member states. In Angola, we have a multi-sectoral committee under the patronage of the President of the Republic, and which is spearheaded by the Minister of Health. In Angola, the first case of COVID-19 appeared on the 21st of March 2020. By the 23rd of November 2020, the country confirmed 14,634 cases of COVID-19 with 0.6% positive rates amongst the 706 people who were tested using the RT-PCR. Last week, we recorded a slowdown in the transmission, and the transmission rate was actually less than 1%. In addition, in order to mitigate the economic impact and measures taken to combat COVID-19, the Angolan government came out with another presidential decree decreeing a state of emergency, and this is nationwide. Now, the isolation of people in quarantine and active case searching and case contact tracing is underway. There is a obligatory wearing of masks to restrict the mobility of people and to protect the Luanda province. 15,367 health professionals have been trained in COVID-19 case management. Rapid response teams have been created in all provinces. We have also set up some technical guidelines. About 700 tons of biosafety material, laboratory equipment, and diagnostic tests have been acquired. 5,000 hospital beds were purchased, which included 589 beds for intensive care, 439 invasive and 255 non-invasive ventilators were required. We also purchased essential drugs to COVID-19 cases, but also for treating chronic communicable and NCDs to maintain our commitment to achieving UHC. 5 field hospitals were built, 5 molecular biology and ELISA serology laboratories have been set up to increase our capacity to carry out 13,000 tests daily. Angola is part of the COVAX facility initiative that will allow access to vaccines to cover 20% of the population. An immunization operational plan is under discussion, and the cold chain is being strengthened at the national, provincial, and municipal levels, including at peri-urban and urban areas which use solar power for their refrigerators and the cold chain. We believe that the COVID-19 pandemic, despite its disastrous effects on the economy and on health, is an opportunity for us to improve our health system and the education of the health education of all people in all fields of life, so that in this way we can benefit the sector as a whole. Angola would like to commend the initiatives that are underway. I thank you for your attention.
Thank you very much, distinguished delegate from Angola. I would now like to pass the floor on to the Honorable Minister of Madagascar. Honorable Minister, you have the floor.
Merci beaucoup, Madame la Présidente.
Thank you, Madam Chair. Regional Director, ladies and gentlemen, Honorable Ministers, distinguished delegates. Allow me, firstly, to thank the organizing committee for this resumed session of the 70th Regional Committee for Africa. We would also sincerely like to thank the Regional Director of WHO AFRO for her leadership in attending to the health needs of Africa as a whole and Madagascar in particular. We would like to take this opportunity to share with you the COVID situation in Madagascar. As you know, Madagascar has also not been spared from the COVID-19 pandemic. We had our first case on the 22nd of March. We had about more than 10,000 or more cases to death, and the mortality rate is 1.16%, but our recovery rate is 16%. The transmission rates are on the decline. However, we do have some cases that we are trying to investigate. We do have to stress the importance of epidemiological surveillance and response so that we can continue to make more progress. We do know that there are some local transmission cases, and therefore the detection of such cases should be strengthened. We should be using gene expert testing. We need to take an approach looking at the hotspots, and that's where we have set up some special committees. We have had a lot of effort and done on the part of the Madagascan population. We do have some imported cases, and we think that as soon as we identify a positive case, we need to follow patients up until they are cured. We are carrying out case searching using our clinics, and we have also been looking the traditional pharmacopoeia, but we are also looking curative regimes. This is based on research that we have undertaken, and this is what we are still evaluating. And obviously, the outcomes will be updated. Of course, this is a real battle which we are staging, and it's been spearheaded by the state. But we need the whole nation to be helping us to combat this pandemic. Of course, we also rely on our technical and financial partners in order to protect our population against adverse events of COVID in terms of our social and economic life. This is indeed a huge challenge for us in Madagascar, but this said, Madagascar is really on track, and I would like to thank you for your kind attention.
Our sincere thanks, Honourable Minister of Madagascar. I would now like to pass the floor to the distinguished delegate of Congo, to be followed by the distinguished delegate of Comoros. Congo, you have the floor.
Thank you, Madam Chair. Excellencies, ladies and gentlemen, honourable ministers, Regional Director of WHO Africa. I am the technical coordinator within our National COVID Response Technical Committee, and I bring the greetings of our Minister on the occasion of the resumed RC70 session. In the Congo, the first confirmed case of the novel coronavirus took place on Saturday, the 14th of March. This was via a passenger who arrived from Europe on the 1st of March 2020. To tackle the pandemic, an institutional framework was set up, coordinated at the national level under the high authority and patronage of the President of the Republic, our head of state. At the operational level, we established a national technical committee within our PHEOC, Public Health Emergency Operations Center, and this is spearheaded by the minister in charge of the COVID response units which have poor health outcomes. Like other countries in the region, Congo came up with a multi-pronged approach to tackle this pandemic, especially at cross-border areas. We do have quarantine measures for travelers. They have to have tests, and this has to be enforced at border areas. We also have a technical setup in our centers and in our hospitals with the right equipment provided. The surveillance mechanism set up has allowed us to detect 5,777 confirmed cases. We regret to announce that there have been 92 COVID-related deaths, even though our treatment centers have enabled us to cure 5,003 people. Cases testing positive reached 38% in May 2020. This is as we enter the third month after detecting the first case. The epidemic in the Congo peaked in August 2020. Not a single district or department in our country was spared by COVID-19. On the 24th of November 2020, the virus circulation rate was established at 6.2%. To date, the Ministry of Health has counted 667 active cases registered through the PHEOCs, the Public Health Emergency Operations Centre. To this figure, we can add an average of 100 new confirmed cases every week for the last 4 weeks. These statistics remind us that the virus transmission chain has not yet been broken, and we must maintain and sustain and strengthen our key control measures, especially epidemiological surveillance, risk reduction communication, infection prevention and control, IPC, and case management. We are striving to put in place a wide-ranging program to decentralize our response to the health district level so as to increase the number of people diagnosed. We need to strengthen the isolation of positive cases and improve the management of asymptomatic cases as well as severe cases. All this with a view to limiting the circulation of the virus and to reduce the mortality rate of COVID-19 patients. We would like to commend the support of the World Health Organization, which has deployed personnel in our district treatment units nationwide, as well as within our National Technical Committee. These WHO experts are really helping us in our battle with COVID-19, and this must continue. Based on our experience, we would like to share the following lessons learned at this stage of the response. We need to maintain aggressive communication as well as active control regarding obligatory mask wearing and physical distancing measures throughout all our response efforts. We also need to provide support to the poorest families and to ensure that COVID healthcare workers are adequately compensated. Health personnel who are not motivated for financial reasons may completely wipe out all our gains in our response efforts. I thank you for your attention.
Thank you. Distinguished delegate of Congo. I would now like to pass the floor on to the distinguished delegate of Comoros, to be followed by the distinguished delegate of Botswana. Comoros, you have the floor.
Merci, Madame la Présidente.
Thank you, Madam Chair. Excellencies, Honorable Ministers, Regional Director, distinguished delegates, ladies and gentlemen, good day. I would also like to commend the WHO for the efforts that they have undertaken in constantly supporting our countries to deal and cope with the COVID pandemic. On this occasion, I would like to reiterate my congratulations to the Regional Director, Dr. Marthe, for the relevance of the recommendations that have been raised since the pandemic emerged. It is thanks to her excellent competence and leadership. Our region is coming out very well. Madam Chair, dear Ministers, Regional Director, Comoros is an island nation with a fragile economy. But we are visited by many people. In spite of all these risk factors to which our country is facing, we have still been affected by this pandemic. We sent in some data to the WHO on the 30th of April with our updated statistics. We have registered more than 6,000 confirmed cases. 700 cases have been confirmed, that is, and 3% were imported cases. We have had a 16% cure rate. We are constantly looking for new cases. If you will allow me, I would also like to commend the President of the Comoros for his personal commitment. After the state of emergency was declared, he appealed to us to set up the necessary structures in order to respond in the best way possible to the pandemic, focusing on coordination, prevention, control of the disease, early detections, as well as logistics, and to have better case management, and the importance of information and communication. We thought it was not necessary for us to have lockdown measures. However, we have taken alternative measures, such as the following. As the pandemic has evolved, and these other mitigating measures have helped us to regulate the way the population moves about, especially at night, so as to really make sure that we would have a fall in the number of cases. We have also paid attention to vulnerable groups and have paid attention to the economic impact that this could have on our population. Given the situation of COVID in our country and its socio-economic impact on us, the government has undertaken certain measurements, especially at cross-border areas. We have restricted schoolgoers and so on. Ladies and gentlemen, the Union of the Comoros would really like to say that it is very important for us to take due account of this catastrophe at the global level. We need to be controlling this pandemic as much as we can, even from the preventive measure upwards. We are very happy to benefit from the support of our WHO and our other partners, especially our WCO, the African Union, and also the private sector of the Comoros. I would like to take this opportunity to address my thanks to the WHO regional director for her multifaceted help provided to us. Madam Chair, on behalf of the Comoros government, I would like to express my appreciation for the support of WHO, who have helped us with their experts, because they have helped all the other stakeholders on the ground in Comoros. This expertise was very important for us to share vital information about the pandemic. This is really an authentic testimony of your commitment to us, to helping us to strengthen and sustain our health systems. The emergence of this pandemic has shown us that we really need to invest further in financing our health systems. We need to strengthen preventive measures, and we need to allow the communities to play their role in really strengthening the health of our populations. On this note, I would like to thank the WHO and all our partners, and let's say that we must maximize on these partnerships that we have been developing. And really, we think that it's very important for us not to be left behind in terms of the preparations that are going on at the global level. I thank you for your attention.
Our sincere thanks, distinguished delegate from the Union of the Comoros. I would to have the distinguished delegate of Botswana, to be followed by the Honorable Minister of Liberia. Botswana, you have the floor.
Thank you, Madam Chair. On behalf of the Honorable Minister, I wish to thank the Secretariat for providing the COVID-19 regional overview and the country's readiness activities update. The Honorable Minister of Health of South Africa, Dr. Mkhize, has also shared some valuable lessons from the pandemic and will utilize as we strive to build strong, resilient health systems. Madam Chair, the COVID-19 pandemic has brought unprecedented socio-economic challenges on our societies and placed a significant burden on our health systems, which will continue as we prepare for SARS-CoV-2 mass vaccination activities. In this regard, we would like to express our appreciation to the WHO Regional and Country Office for the strong explicit support during this process. My ministry is also working with other UN partners, which include WHO, UNICEF, our National Medicines Regulatory Authority, key government ministries, as well as other relevant stakeholders, in order to ensure that once the vaccine has been availed, its deployment to target groups will proceed efficiently. Botswana welcomes the regional director's report detailing the progress made and key achievements in the first 6 months of the COVID-19 response, as well as the priorities and challenges going forward. As guided by the Regional Strategic Preparedness and Response Plan, we support the progress in distribution of the COVID-19 equipment and products across countries, the training of frontline workers on COVID-19. Madam Chair, the strengthening and decentralization of laboratory testing capacity and training of healthcare workers with Africa CDC and other partners is a key milestone. We therefore call on the WHO and partners in continuing to support our countries to ensure that the gains that we have achieved in the health sector are not lost, and request for partners' support to increase flexible funding for the WHO as the COVID-19 challenges demand constant strategic review and local adaptation of the response based on emerging issues. Lastly, we wish to congratulate the government of the Democratic Republic of Congo, supported by the leadership of the WHO Regional Director and partners on ending the 11th Ebola outbreak, approximately 6 months after the first case were reported in Equatorial Province. We also acutely are aware that much work needs to be done to maintain and sustain this achievement. I thank you, Madam Chair.
Many thanks, distinguished delegate of Botswana. I would now like to pass the floor to the Honorable Minister of Liberia. Honorable Minister, you have the floor.
Thank you, Madam Chair, to the Regional Director and all the distinguished delegates that are all present here this afternoon. We want to say a big thank you to WHO for all of the support that you have given Liberia, including the recent setting up of the polio or the new occurring polio diseases that are occurring in the neighboring country and helping us to prepare to protect Liberia from any new polio virus. So we want to thank you for that. We also want to commend our president because during the beginning of the COVID-19, he set up a special presidential task force that called each member of the different government agencies together to fight the COVID-19. In the beginning, before the first case, we were able to, our National Public Health Institute were able to start the preparedness process at the airport and other borders to make sure that we catch any case of COVID-19. The first case came into the country in March, where the incident management system was set up. that contains pillows, case investigation, case management, contact tracers, the National Reference Lab, RPC, and others that were set up to make sure that all the cases were caught. We had 3 curfew. We didn't have lockdowns, but we had curfews that ended around 3 o'clock, where we saw a huge decrease in the number of cases. We did very well. We were one of the first countries to start testing the bodies for COVID-19, which helped us to be able to identify contacts. We're now noticing a second wave, like most other countries. It started in October and it started climbing. Our testing is voluntary testing, so we are getting a decrease in the number of people that want to volunteer. I'm sure other countries are experiencing the same challenges that we are experiencing, but most of our cases are found in the outgoing travelers because we are testing those who want to travel. So most of the cases are being identified in that group. There are cases that are identified in the incoming travelers, but majority of the cases are outgoing travelers. We started enhanced surveillance in those areas that the outgoing travelers are residing. So that's helping us in terms of identifying them and be able to isolate them. We have a lot of people now that we have started using home-based care. We have a lot of these outgoing travelers who are individuals that live in their own residence and they have no comorbidities. They are in home-based care, as we are still running our treatment unit where we are putting those who have comorbidities or signs and symptoms of the disease into those areas. We're trying to move now to routine services to incorporate the COVID-19 into routine services. We haven't completely completed that analysis yet, but we are almost there where we'll be going back to routine services because I think we are neglecting the routine services and we are focused now on COVID-19. But like WHO have been telling us all along that COVID-19 will not end except every country has ended it. So we are hoping that with the vaccine that coming, that Africa and the entire region will not be forgotten and that we are able to be part of or receiving the support that we need to get the vaccine. We are also hoping that WHO will let us know about the rapid tests. We keep asking, but we're not getting the clear guidance on which one of the rapid tests we should be using. And we don't want to use all of the ones that are on the market except is WHO certified. We want to thank our WHO rep. He's doing a great job in terms of supporting us in many, many areas. We want to thank the regional office for all of the things that we are receiving in terms of ventilators and other gifts. Thank you all for listening.
Thank you very much, Honorable Minister of Liberia. I would now like to pass the floor on to the Honorable Minister of the Central African Republic, to be followed by the distinguished delegate from Mali. Honorable Minister from Central African Republic, you have the floor.
Madame la directrice régionale.
Regional Director.
Madame la directrice régionale.
Regional Director. Honorable Ministers and dear colleagues. The Central African Republic would like to congratulate the Regional Director and her team for their goodwill and their active thoughts. National mobilization against COVID was was chaired by the president himself, and the response was organized on the basis of two major points. One was to limit the propagation, and the second was to reduce mortality from the disease. Essentially, evidence-based, the response was based on systematic screening of persons coming from areas of local transmission and screening of suspect cases. With this, we were able to identify the channels of propagation of the disease, especially cross-border sources. More than 70% of cases were asymptomatic, and serious cases were in cases of patients with comorbidities. And most of the deaths were at home. On the basis of this observation, we adopted new strategies based on screening of symptomatic cases and contact tracing. This was a more efficient approach, which enabled us to direct resources towards strengthening the health system and continuing to provide vaccination services and other essential services. The main lessons learned from were as follows: the need to put in place measures and strategies to deal with the outbreak, which were evidence-based. Strategies placed in place had to be dynamized and changed on the basis of data collected. In spite of international solidarity, aid efficiency was a challenge. A community-based approach was crucial. Members of the community had to own the combat. That helped to eliminate stigma, ensure early screening, and strengthen synergy with public health programs. In light of various fake news, introduction of the vaccine should be carried out in a very prudent manner. Madam Regional Director and dear colleagues, this is the presentation I wanted to make at this regional committee. Thank you.
Thank you very much, Honorable Minister from the Central African Republic. I would now like to give the floor to the distinguished delegate from Mali. Mali, you have the floor.
Mesdames et Messieurs, Madame la Directrice Régionale.
Madam Regional Director, Dr. Moeti, Honorable Ministers, ladies and gentlemen, on behalf of the Minister of Health and Social Development, Dr. Fanta Sibi, we would like to sincerely thank the Secretariat for the quality of and the success of the session. Mali, like other countries, has also experienced this outbreak. And from the first cases, we came up with a strategy which consisted in putting in place a coordination that espoused the health system, strengthening epidemiological surveillance at airports and other ports and all over the country, improved the development of isolation centers, social mobilization, strengthening of logistics and stocks, development of national, sub-regional, and international partnership, and establishment of introduction of preventive measures to reduce the risk of propagation and migration of the virus. Since our first case on the 27th of March, we were also the first country in the sub-region to introduce testing of cases, but to date, we have an epidemiological situation whereby with about 4,000 plus cases and deaths totaling 145, and a mortality rate of 3.2%, and more than 33,000 cases healed. Our situation evolved in first cases. The first case was isolation for the first or second week. And then we had a plateau from the 21st week to the 30th week. And in the last few weeks, we have noticed a renewed spike in the number of cases. Out of the 75 districts, 38 were affected. And the places that were most affected are Bamako, Timbuktu, Kulukoro, and Kai. Men were more affected with about 67% of cases, and the age bracket was between 24 and 65. We had a number of challenges in spite of the international solidarity we enjoyed, which consists in improving our screening, strengthening preventive measures, controlling the flow of population across borders, and ensuring mobilization of resources. Honorable ministers, this is the opportunity for us to thank the WHO country office, particularly with the representative, Jean-Baptiste, for the quality of technical support and collaboration that we receive on a daily basis. Mali, obviously, is counting on the COVAX initiative so that we can have the vaccination that will shelter us from this virus. Thank you.
Thank you very much, distinguished delegate from Mali. Chair, if it's okay with you, I would like to confer with Nigeria, because we believe they had raised their hands earlier, to see if they would still like to take the floor. But Nigeria, could you please let us know if you'd like to take the floor by raising your hand? But at this moment, I would like to give the floor to the distinguished delegate from Sao Tome and Principe. Sao Tome and Principe, you have the floor.
Eu quero, em primeiro lugar, deixar os agradecimentos.
I would like to express our gratitude to the WHO and to the regional director and say that our country, an island country with 200,000 inhabitants,
tomamos as medidas mais corajosas,
has taken courageous measures to control the outbreak. This is how that we were immune from it for several weeks, and more recently we have had an increase in the number of cases. Subsequently, the transmission has been reduced until the country opened up again. But we remain alert so as to control any possible calamity from this disease. I would like to say something on the COVAX mechanism. I think it is extremely important for us, and the message is that we take into account all the aspects that are necessary through, such as the establishment of a task force and the provision of the funding, information and communication, partnership. We believe all of these are necessary. The message that we bear in mind is that even the small countries should come up with mechanisms that will be adapted to us so that we can participate in COVAX. In other words, there should be special attention to the case of the small island countries, because they also need to be reckoned with in this gathering of countries. So on this note, we want to express our gratitude to our partners, and in particular to the World Health Organization, and specifically to the regional director. I thank you.
Thank you very much, Honorable Minister. Thank you. I would now like to pass the floor on to the distinguished delegate from Nigeria, Nigeria, you have the floor.
Thank you very much. Firstly, just to say that Nigeria recognizes the strong role WHO has played in coordinating the global response to the COVID-19 pandemic, especially in challenging circumstances. Nigeria is grateful for the strong collaboration and support from WHO at the global, regional, and country levels in strengthening the country's response activities. Madam Marthe, thank you very much for your leadership and coordination with Dr. Nkengasong of Africa CDC on behalf of the continent. Following the initial alert in January by WHO of the cluster of cases in China, the Federal Ministry of Health, through the Nigeria Center for Disease Control, established a multi-sectoral coronavirus preparedness group even before we found the first case. This preparedness group eventually transited into a national EOC to coordinate the national response on the 27th of February, when Nigeria's index case was reported. Public health EOCs were subsequently activated in each of Nigeria's 36+1 states. The President of the Federal Republic of Nigeria also established a presidential task force on COVID-19 that is coordinating the multi-sectoral efforts in the country. The PTF, led by the Secretary to the Government of the Federation, has provided high-level leadership to the response. Nigeria has continued to scale up surveillance, laboratory capacity, case management, risk communications, community engagement, and other response activities. After a national lockdown, Nigeria has successfully reopened sectors of its economy. Currently, Nigeria is carrying out an in-country validation of the WHO emergency use approved rapid diagnostic test kits, as well as rolling out these kits in closed settings. Nigeria has invested significantly in the training of healthcare workers in case management, surveillance, and other response activity, prioritizing infection prevention and control to ensure health worker safety. Despite the initial challenges with accessing the global supply chain for medical and laboratory supplies, the Federal Ministry of Health has maintained a stockpile of response supplies and sustained a national distribution of personal protective equipment since then. We've established a coronavirus vaccine technical working group to coordinate our preparedness for vaccine deployment and use. We are fully aligned with the COVAX initiative and the guidance produced through this initiative for vaccine introduction. And Nigeria recognizes the critical importance of equitable access to vaccines, therapeutics, diagnostics, and other tools required to control the acute phase of the pandemic. We call for continued solidarity among countries and support from WHO to member states to develop sustainable structures to serve current and future outbreak response. Nigeria continues to adhere to international health regulations through daily publication of our outbreak situation, adoption of guidance from WHO, and public health research activities, participation in the WHO Solidarity Trial, and other measures to control the spread of this outbreak. Finally, Nigeria recognizes the critical importance of assuring health security in the continent moving into the future, and recommends that WHO supports member states to use this crisis to build horizontal structures that will increase our collective resilience to similar threats in the future. I thank you.
Our sincere thanks to the distinguished delegate from Nigeria. Many thanks. Chair, I do not see any other hands raised. I would suggest we wait for a second or two to see if any other delegate would like to take the floor. Honorable ministers, distinguished delegates, please let us know if there's anybody who would like to take the floor. Chair, I don't see anybody else wishing to take the floor. I would like to therefore pass the floor back to you, Honorable Minister of Benin. The floor is yours.
Merci, Madame Dramé.
Thank you, Ms. Drame. Thank you, ladies and gentlemen, for this very active and fruitful debate. I now kindly ask the Regional Director to wrap up the session by also giving us indications on the way forward. Dr. Mweti, the floor is yours.
Merci, Monsieur le Président.
Thank you very much, Chair.
I'd like to thank all the ministers who took the floor for this session, and would like to thank also Honorable Minister Mkhize for the insightful presentation on the comprehensive response in South Africa. I also appreciate very much the input made by my colleagues. Thanks to all the delegates and ministers for your appreciation of the collaboration with WHO and for having shared your own experiences, best practices, and lessons learned in the COVID-19 response in your countries. As mentioned by the distinguished delegate from Angola, showing how you are using this crisis as an opportunity to strengthen national and provincial health services and to improve education in communities. I would like to pay particular homage to our colleague from South Africa, Minister Mkhize, for having shared very thoroughly in detail your analysis, your approach, the adjustments that you made, the lessons that you've learned, the challenges that you faced, and the response that you have made during the past, now, and also going into the future. I think we have pulled a lot of lessons for the response in the region out of that. In wrapping up the discussions with cases resurging in Europe and elsewhere, and with the uptick in some countries, vigilance will indeed be key to prevent a second wave from going across the entire region. So I very much appreciate what the ministers have said about what you are doing and what you are planning to do in order to reconnect with the community. There was a lot of discussion about improving communication, recognizing the fatigue in the population, and also recognizing the fatigue in the healthcare workers. And I think here we have to pause and really acknowledge that our colleagues who are at the front line in our clinics, in our hospitals, in the laboratories doing the testing, have really done tremendous work and have sacrificed a lot for the picture that we are seeing across the community, across the region today. The public health capacities, including active case finding and surveillance, need to be aligned to the differentiated risks and realities in each country, in each province, in each city, and in each district. This was very well illustrated by the presentation from South Africa. It was emphasized by several of the ministers as well. Indeed, testing has been a challenge. And here, in my own remarks and in our presentation, we did not highlight the challenges, but we saw very well how having access to testing supplies, to testing kits, has been a challenge throughout this pandemic. It continues to be so even today. When we look with my team in WHO at the testing rates in the different countries, we recognize that our low-income countries are the ones that have faced the biggest challenge. We have seen that between 10 to 15 low-income countries have never been able to test at the level that WHO recommends. They have consistently been testing at 5 per 10,000 or lower. So indeed, as an international community, we have to acknowledge we have been challenged to support the testing adequately in countries. We need now to ensure that the testing at the domestic level in relation to public health interventions, as well as in relation to travelers, because we've noticed an increase and a tendency towards investing a lot in testing travelers as the situation has evolved with the opening up of the lockdowns. I heard one of the countries indicate how from testing travelers, you are then going locally to where they came from to making sure that you discover the cases, the contacts, and continue the public health intervention. So that's one, how can I say, adaptation to the challenges that we are facing in having access to testing supplies. Communities indeed need to continue to be engaged and part of the solution. Particularly, we have to address misinformation that came out as well in your comments. You made allusion to the need and the challenges of continuing to provide other services. This is something that needs to be monitored so that we see that we do not have a decrease in the coverage of some of the services which you have worked over the years so hard to provide to populations. Thank you for your comments and response with regard to the vaccine. Indeed, we are very ready to support you in terms of the readiness, the need to proactively address the challenges, including the logistical challenges in this effort. I'd just like to reiterate something that my colleague mentioned in terms of the financing of in the COVAX platform. 20% of the vaccines, or vaccines to cover 20% of the populations, will be provided from the platform without need for countries to engage in terms of co-financing. But I really would like to encourage then the engagement for the rest of the supplies. We're very happy about the work that is being carried out by the African Union and the Africa CDC, and we imagine that the financing of some of the rest will come from this mechanism. And we are in conversation with Dr. John Kengasong of the Africa CDC to see how we can exchange information to do a kind of mapping. What we would like to see is a mapping of the financing for each and every member state to assure ourselves that over and above the 20%, you are making the efforts, others are making also the effort to provide the funding to make sure that we reach a coverage of the population in our member states that will make the difference and put a stop to the transmission of the vaccine. So we need to hit those levels that are going to be able to make sure that we provide sufficient to put a stop to the transmission of the vaccine in terms of herd immunity through sufficient coverage. I will advocate intensively for equitable distribution of the vaccines in the discussions with partners in our contribution to the discussion in the platform at the regional level and at global level. Our collective advocacy is really needed to ensure that African countries are not left behind. So I too count on your support, honorable ministers and delegates, to keep equity and solidarity at the forefront of discussions of the vaccines at the sub-regional level, at the continental level, and at the international level. We appreciate the support expressed by member states to extend the GPW 13 as far as the program budget is concerned to 2025, and this will help us to collectively advance further on the triple billion budget. I'd just like to end just going back to the COVID-19 and the COVAX mechanism. A question was raised by our colleague from Mauritania about why we are not going for the more efficacious vaccines that have been announced with efficacy levels of over 90%, and are rather emphasizing the availability for the African region of the AstraZeneca vaccine, which is efficacious at about 70%. I'll ask Richard to come in and address that question specifically, just emphasizing that 70% efficacy will be sufficient to make an impact on the transmission of the vaccine. And we also very much are looking forward to the availability, the affordability of the vaccine. But with your permission, Chair, I will ask that my colleague, Richard Mihigo, come in to answer some of the questions and also give a minute to Dr. Yoti to respond briefly to some of the comments that were made on the matter of the COVID-19 more generally. So again, thank you very much for this very active participation, exchange of experiences and views. And I would like to promise you that we are going to keep on pressing on about the equity, because indeed, we don't want our countries to be left behind in having access to this very important prevention tool. So Richard, if you could respond specifically to that question, or any other, and any others as well, when you think your supplementary comment is necessary. Thank you, Chair.
Thank you very much. Thank you very much, Dr. Moeti. Maybe to address the question by the distinguished delegate from Mauritania, I think the data that were published yesterday by AstraZeneca are interim data that are showing, as indeed you mentioned, 70% efficacy. But we need to understand that these are pooled efficacy data because the clinical trial with the AstraZeneca vaccine had two doses regimen. The first dose regimen, which was giving 2 doses, a half dose followed by a full dose, also reached an efficacy of 90%. The second dose regimen, which was using 2 full doses, had an efficacy of around 61%. So the 70% is kind of a pooled data. So I think it may be earlier to conclude about this 70% because once the final data will come out, we may see a completely different picture. Remember that during the first data that were released by Pfizer, the interim data was talking about 90% efficacy. And when they released their full data, it came to 95% efficacy. So even though the current pooled efficacy data is around 70%, I think Dr. Moeti said it very well, 70% for a vaccine like that will be really a very good efficacy. And a very important element that we need also to consider is the ability of rolling out this vaccine in our condition. So this vaccine definitely is providing a quite interesting feature because it used our current system. It will be easier to deploy, it will be easier to store compared to the other vaccine. And I would like to conclude on that particular point by saying that in one of the slides that I showed, I think the use of other vaccine, particularly those using the messenger RNA vaccine, in the Pfizer and Moderna, I think it's not necessarily closed. I think there are projections on how a very, very limited number of doses could potentially be made available in the first part of the year. But because we are going probably to stay for a long period in this outbreak, I believe the data that was released by AstraZeneca had really, really a major development, particularly for our region. The other point that were raised by the Honorable Representative from Mauritania was in line with co-financing. I think Dr. Moeti have already responded to that. And the first point was in line with the country that have ability to pay. So it's not 2 countries, as it was mentioned. The self-financing country in our region, there are 7 countries. So those are South Africa, Botswana, Namibia, Mauritius, Seychelles, Gabon, and Equatorial Guinea. And then finally, Sao Tome and Principe, I think Dr. Moeti have already really responded to that, the advocacy that needs to be done even for these small island developing states that needs to, at some extent, will require a special attention. So in conclusion, I will say that we are going to continue to work with country, particularly through the task force that has been established by the regional director to make sure that the preparedness and the mapping of all the different key inputs to make sure that country are going to be ready at the D-Day when the vaccine starts to be rolled out. So thank you very much, Dr. Moeti.
Thank you very much, Richard. I'll also say to honorable ministers that we will share this presentation that you made today, because it had some quite detailed information, so that ministers can have the time to digest it and extract from it some of the action points. And we'll also make sure that at the country level, our country offices follow up with them then on the next step based on the information provided, which we will update regularly. As Richard said, the situation is changing every day with regard to the vaccines, and it's very important now for us to keep closely in touch with the honorable ministers. Merci beaucoup, Monsieur le Ministre. Dr. Yoti, I don't know if you want to say anything briefly in response, then we'll close the session.
Thank you very much, Chair Dr. Mweti. We really appreciate the suggestions you have made, the experiences you have shared, including the innovative ways you are addressing COVID and also providing essential health services and building capacity. I would just like to respond to two questions. One question was from Liberia on a number of rapid diagnostic tests, which one to choose. Indeed, the RDTs came sometime back, right from May, and there were many. And then this difficulty was real. So we worked together with Africa CDC, of course, under research as well with the WHO headquarters and the institutions to try to evaluate those which were in the market. So as I speak now, there are 3 which are available in the market, which were approved for emergency use. And of these 3, they are all antigen-based RDTs. And this is the one Africa CDC and WHO issued guidelines on 9th of September with very clear algorithms on how to use them. And these are available, and our team is really ready to support, continue to support you, honorable ministers, and technical teams on their use. We have also seen that, very interesting, many of the countries have placed orders for this rapid diagnostic tests. And our team, of course, continues to follow and support delivery of those RDTs. This will drastically increase our testing capacity, as we're all emphasizing on decentralizing testing at the local level. The second question was, I think, on research on traditional medicines, especially in Central Africa and other countries as well. Honorable ministers, I would like to inform you that Dr. Mweti and Dr. John Kengashon worked together to establish expert advisory committee on traditional medicines, what we call REACT, the Regional Expert Advisory Committee, which is composed of 25 experts from the countries. And thank you very much for availing those experts from your countries to be part of this committee. It was launched on 22nd of July, and they held their first meeting on 18th of September to adopt a roadmap towards assessing what medicines are out there, which need to be researched, and where possible, also protocols help the countries to refine their protocols for really doing the research. So a lot of work has been done, but the issue remains mobilization of resources. That remains a challenge. So advocacy for additional mobilization of resources at our level, but also at country level to support this team so that we look into research beyond this particular traditional medicine would be quite key. I must end here by saying operational research around testing has allowed really people, all the countries, to adjust their testing strategies very fast. So it's not only the clinical research, but also operational research, which has allowed all the strategies to be adjusted. We've seen good example in Senegal, where now they're using tests which give results within 30 minutes, 15 to 30 minutes. So we'll continue to support those innovative ways. I think I'm going to stop here with my response. Thank you very much.
Okay, thank you, Zabulon. Monsieur le ministre, si vous permettrez, si Monsieur le ministre de l'Afrique du Sud peut dire un dernier mot.
If you allow me, perhaps I would like to invite the Minister of South Africa to have a final word to close this session. Thank you very much, Dr. Moeti. This brings us to the end of this special event on the COVID-19 response in the African region. Sorry, I was just saying that if you would allow me to give the floor to the Minister of South Africa for a final word on this topic. Yes, okay, very well, thank you.
Well, thank you very much, Chairperson and the Regional Director, and to all the colleagues. I just want to indicate our appreciation for just listening through a number of country experiences, which I think have lessons for all of us in different ways. So I do appreciate that. I'd like to just urge that the issue of vaccines, we probably need a forum to discuss it a little bit more. There are lots of issues that need to be cleared. I think the question of the choices of the vaccines would be a very important issue for us to discuss. Which vaccine ultimately are we looking at? And also the issues looking at other updates in terms of all the initiatives that are going on. There's COVID processes, but also I think it was well presented here, but it would also be important to discuss our own level of readiness in terms of preparations as different member states, as well as whether there's any other support that we need to be able to deal with the issue of vaccines as and when that matter is concluded. I think for all of us, as we sit, we remain very anxious that our region should not remain behind when the the vaccine processes unfold. And I think it's important for all of us to get a sense that we somehow are settled with the situation where things are. I'm aware that as we participate in other programs such as ACT Accelerator, that there's a lot of effort to mobilize various resources, and also as indicated on the African Union task team on vaccine, that some work is also being done there. But it will be good for all of those players to be able to table the issues here, so that the member states are able to follow what decisions are being taken and what choices we have to make, and so on. I think our concern as we sit with the situation in South Africa, our concern is seeing that the outbreaks that are coming up, that they may in fact spread into a real second wave. And so I think learning from each other continues to be very important. And so at this point, the challenge is going to be that there's been opening up already of movement between various countries, and lockdowns have been eased. There's lots of movement. And so whatever happens, if we stay in touch, we're able to always know whether there are any new precautions we need to be taking, even if it may not have reached our countries, but based on what's happening on the neighbors. And I think we're one of those neighbors that start getting problems, and then I'm sure everyone will know that that begins to affect others who are our neighbors as well. So I think this kind of session has been helpful from that point of view. I want to say thank you very much. But if we could look at the possibility of a much broader debate on the discussion on the issues of the vaccines and all the issues, it would be very, very important for us. Thank you very much for the opportunity.
Merci bien,
Honorable Ministre d'Afrique du Sud.
Thank you very much, Honorable Minister from South Africa, Regional Director to you. Thank you very much, Honorable Minister.
Suggestion for more connectivity. I would very much agree. I think if honorable ministers would be positive, one of the things we could do perhaps is a joint briefing between WHO on the COVAX Accelerator platform and the Africa CDC on what is happening at the level of the African Union around vaccines, so that we put this information in front of the ministers at the same time. And there's the opportunity to look then at what is coming from each of the sides, how the countries can work with both of these mechanisms in a way that we would hope would become synergistic. We could work together with the Africa CDC in preparation of such a joint briefing, but really to have a real-time discussion at the same time of the two processes, I think would be beneficial to our member states so that we can see if they can complement each other, particularly in relation to the financing and even information around the choice of the vaccines, why this one, who is negotiating with which producer of which vaccine from both sides. I think if we put those two sets of information together, it will be extremely helpful to countries as a starting point. So perhaps if you permit, we can reach out to the Africa CDC and with the Minister of South Africa working with us, since you are also working with through the chairpersonship of President Ramaphosa of the African Union, with them directly, then we can find the best way to keep up this dialogue. So that would be my suggestion. Thank you. Thank you very much. Merci, Monsieur le Président.
Thank you, Chair.
Bien. Merci infiniment, Dr. Moeti.
Thank you so much, Dr. Moeti. I think that this now brings us to an end to the special event on the COVID-19 response in the African region. Thank you to everyone. We will now consider agenda item 5, draft provisional agenda, place and dates of the 71st session of the Regional Committee. Kindly refer to document AFRO RC 7015. Firstly, we will consider the draft agenda of the 71st session of the Regional Committee. Are there any comments or observations from the distinguished delegates? I would once again like to invite Mrs. Takayenzana to moderate the discussion. Over to you, Mrs. Takayenza.
Thank you, Chair. Honorable Ministers, distinguished delegates, the floor is open for any comments on the provisional agenda for the 71st session of the Regional Committee. If you would like to take the floor, kindly click on the icon on participants and then select the blue hand on the bottom right side of your screen. I see that Zambia would like to take the floor. The Honorable Delegate from Zambia, you have the floor, please.
Thank you very much. Chairperson, thank you for giving Zambia this opportunity to take the floor and make a statement on this important agenda item. The Republic of Zambia supports the proposal for the 71st session of the Regional Committee for Africa to be hosted by the government of Togo and has got absolutely no objection on the proposed dates of 23rd to 27th August 2021. Chairperson, we wish to propose also that an agenda item be included to focus on the effects of COVID-19 pandemic in the African region, as well as other emerging issues that might be applicable at the time. I thank you.
Thank you very much to the distinguished delegate from Zambia, and we take note of your comments relating to the dates and the place of the 71st session. I hand over the floor to the Honorable Delegate from Mauritania. Mauritania, you have the floor, please.
Bonjour. La Mauritanie.
Good afternoon. Mauritania takes good due note of this point item agenda. We do agree with the hosting of RC71 in Togo, but before this, I would like to propose to the regional director if we can actually review the situation every month. I think perhaps that we need to hear from the countries, so in regard to this draft provisional agenda, because it's very important for us to control this pandemic. It's just a suggestion from my part, which is really in the sidelines of the regional committee, properly speaking. Thank you.
Thank you very much to the distinguished delegate from Mauritania, and we also take note of your comments concerning the place of the regional committee. Chair, I do not see any further requests for the floor specifically on the draft agenda of the 71st session of the regional committee. Over to you. Chair, perhaps you are on mute. We cannot hear you. Honorable Minister from Benin. I think that you are on mute. Yes.
Je vous remercie.
Thank you.
J'invite maintenant les distingués
I would now like to invite the honorable ministers to make comments on the date of the 71st session of the regional committee. Please, could you assist me in moderating, Mrs. Takayanzana?
Thank you, Chair. Distinguished delegates, honorable ministers, if you would like to take the floor concerning the proposed dates for the 71st session of the regional committee, the floor is now open. Kindly raise your hands. The proposed dates are 23 to 27 August 2021. Chair, I do not see any requests for the floor. I hand the floor over to you, Honorable Minister of Benin.
Merci infiniment. Enfin, nous examinerons le lieu de la 71e.
Finally, we will be considering in this regard, I would like to recall that at the 69th session of the WHO Regional Committee for Africa, through Decision 4, it was decided to hold its 70th session in Lomé, Togo, from the 24th to the 28th of August 2029. However, a physical in-person session was not possible due to the measures put in place in response to the COVID-19 pandemic. Therefore, the government of Togo has underscored its readiness to host the 71st session of the regional committee. I invite comments from the delegates, and once again, I would like to pass the floor to Takayanza to moderate this discussion.
Thank you, Chair. Honorable Ministers, delegates, the floor is now open concerning the place of the 71st session of the regional committee. And we note that comments have already been presented by Zambia and Mauritania in support of Togo to host the regional committee from 23 to 27 August 2021. Chair, I do not see any further requests for the floor. I therefore hand the floor back over to you.
D'accord. Je vous remercie, Madame Takwenzana.
Thank you.
Projet d'ordre du jour de la
Madame
71e session du comité régional tel que proposé dans le document
The
AFR
draft
RC
agenda
70/15
of the
est donc
71st
approuvé.
section is therefore approved as
En outre,
proposed in the
la
document.
session du comité
In
régional
addition, the
donc
71st
Lomé au Togo
session
du 23 au
of the
27
regional
août
committee will be held in
2021.
Lomé, Togo from 24 to 28 August 2021.
Je vérifie la date. C'est bien la date, 23-27.
It's 23
to 27th August 2021.
Très bien. Il en est donc ainsi décidé.
It is so decided.
Messieurs, nous sommes maintenant arrivés au terme de la
Ladies and gentlemen, we
70e
have
session
now
du comité
reached the
régional.
closure of the 70th session of the regional committee. May I now request the regional director to address the regional committee. Dr. Moeti, you have the floor.
Oui, merci beaucoup, Monsieur le Président.
Thank you,
Honorable
Chair.
or Vice Chair of the Regional Committee, Minister of Health of Benin, Honorable Ministers of the African region, dear partners, colleagues, friends, ladies and gentlemen. I'd like to profoundly thank, first of all, the chairs for the very efficient ways in which they collaborated together to conduct the business of our meeting when we had challenges with the technology of a meeting of this type, to the Honorable Minister of Health of the Congo. Thank you so much for having stepped into the breach, the two vice chairs. It was really a collective effort to run this meeting. I'd also like to thank the ministers and the heads of delegations, other delegates, the partners for having stayed with us throughout the day after a very short break. Again, these are some of the new ways of working that we've had to adapt because of the pandemic. We have had extremely fruitful discussions on two important matters of our work in WHO. First, I'd like to thank you for the constructive comments on the WHO program budget, where again, we've had to make adjustments in terms of the schedule of the GPW13, the consultations, or as far as we are concerned in the African region, the challenges that we've had with consultations in order to work with you on the program budget. Bon, je note avant de continuer, Monsieur le Ministre.
Before I go further, Honorable Minister, I see in the chat that Togo is asking for the floor. So with your permission, I will stop at this point for a moment so that the Honorable Minister of Togo can take the floor. I believe that he would like to close the discussion relating to the venue of the next regional committee. With your permission, Honorable Minister. That's no problem. Togo, you have the floor, Honorable Minister.
Bonjour, Monsieur le Président. Ce n'est pas le ministre de la Santé du Togo.
Good afternoon, Chair. It's not the Minister of Health, it is Dr. Yasingbe.
De la mission du Togo à Genève.
Of the Togo mission in Geneva.
D'accord, vous avez la parole.
You have the floor.
Madame la Directrice.
Honorable Chair, Regional Director, Honorable Ministers, dear colleagues. On behalf of the Honorable Minister of Health of Togo, I would like to take the floor to congratulate the Africa region for the brilliant manner in which this resumed session of this regional committee was organized. I would also like to thank all member states of the Africa region that supported Togo so that Togo can be the host country of the next session in August 2021. We hope and pray that this pandemic can be under control so that Togo can at least have the privilege of hosting you all in the country, but you can have a taste of the warmth of Togo and appreciate the beauty of our Togolese capital and other places that we hope will give greater visibility to our country. I could go further than that, but I don't want to take too much of your time because we are at the closing ceremony. So I simply would like to appreciate the efforts of the regional director on a daily basis in the Africa region. We also commend the efforts that have helped enable us to come to the end of the Ebola epidemic in the DRC. I would like to congratulate all member states and remind everybody on the need to respect the preventive measures so that we can overcome this pandemic, which is causing so much damage globally. Thank you, Chair. Thank you, Rardi. Thank you to everybody who has participated in this session. I thank you. Thank you. Thank you very much, Dr. Yasingbe. Speaking on behalf of the Honorable Minister of Togo. Ardi, do you want to continue now before I close the session? Yes, Honorable Minister, it will be very brief.
Quelques remarques de conclusion.
I just want to make a few comments by way of conclusion in English.
I would also like to thank the delegate from Togo and say how much we look forward to coming to Lomé, and that will depend on our collective work in the next year to make sure that we put this COVID-19 virus and pandemic under control sufficiently to allow an in-person meeting. So that's one more motivation for us to add to all the hard work that everybody is doing on the pandemic. I will not be long. I think it has been a long day for everyone. It's simply to appreciate the contribution of the ministers, both to our discussions today. I was saying something about the discussion of the program budget, indicating that we will reach out to enable the consultations on the program budget, which we have so far found to be a challenge because of the rhythm of the work that you are doing at your level and we are doing in the Secretariat on the program budget. But we recognize its importance. And again, we thank you for having agreed to the extension of the GPW 13 to 2015, because we did not hear any comments to the contrary. And we promise that we will then engage in those discussions on the program budget. Again, just to repeat, we will follow up with regard to the COVID-19, especially the access to vaccine, because that is an urgent matter of the moment, even as we are all going to take a rest, hopefully, in the next few weeks. I took note of the recommendation from the Honorable Delegate from Mauritania for more regular contact and updates among each other with ministers. We did not want to do that to you because we know that you're already engaged in the global member state meetings, which are organized by Dr. Tedros, but we would certainly be very happy to touch base regularly with the ministers and with the senior officials on the COVID-19, especially going forward as we are going to be with regard to some very intense activities around the vaccine. I would just like to conclude by wishing everybody very well as we are going towards the festive season. I think several of us have already noted that this is a season where we hope to get together with our families, but that in itself and other activities of the festive season constitute a risk. And I think we face the collective challenge of helping our communities to celebrate Christmas, if they're Christians, the end of the year, in such a way that it does not add to the severity of the pandemic in Africa. And I'd like to promise that from our side, we are trying to think about strategies on communication. I was very interested to hear from the South African minister about the big mobilization of people on the ground that they did around testing. My own personal observation when I move in the town where is that people are indeed tired and relaxing. But if you remind somebody in the supermarket that please pull up your mask properly and please keep your distance from me at the queue for the supermarket, they say yes politely and they do it. So what I've understood is that we have a need for people to be on the ground every day, reminding people politely about these measures. And of course, our duty is to make sure that communities have the means to do what they need to do. So I hope that honorable ministers, honorable delegates, colleagues and partners, you get the opportunities to have a very well-deserved rest. Because if the communities are tired, I think ministers are very justified in being tired. I know that you have been working day and night in a very challenging context to keep up the pressure on the pandemic. And again, I'd like to congratulate you for the fact that we find ourselves in such a situation as a result of all your actions. I'd like to thank you also for the excellent collaboration this year with
Merci bien, Madame la directrice régionale. Madame la directrice régionale, Mesdames et Messieurs les ministres, je voudrais, avant toute chose, au nom de la présidente de cette 70e session du comité régional, Madame la ministre de la Santé du Congo, et de la deuxième vice-présidente, la ministre de la Santé de l'Éthiopie, vous remercier encore une fois pour la confiance que vous nous avez faite et puis pour l'accompagnement dont nous avons bénéficié tout le long de ces travaux. Ça n'a pas été évident, la technologie a parfois fait défaut, mais nous avons, grâce au secrétariat, vraiment su coordonner et assurer de bout en bout la tâche que vous nous avez confiée. Je voudrais féliciter encore une fois la directrice régionale pour la qualité de l'organisation de cette 70e session du comité régional et vous dire combien nous sommes heureux de la manière dont ça a pu se dérouler, mais également des sujets dont nous avons débattu. La principale préoccupation de cette session a concerné la crise sanitaire qui nous touche et à laquelle nous faisons face quand même avec beaucoup d'efficience et d'efficacité a priori en Afrique. Je pense que l'union qui fait la force, qui a toujours fait la force et qui a toujours prévalu, est là et nous amènera à avoir d'ici peu, on espère, la victoire sur cette pandémie. Les efforts sont permis, tous les efforts sont permis à travers les discussions que nous avons eues et j'ose croire qu'en août 2021, à Lomé au Togo, nous allons pouvoir nous réjouir d'avoir conjugué au passé les relents de cette pandémie. Mesdames et messieurs, donc, je voudrais, sur ces mots au nom de la présidente et au nom de l'ensemble du bureau, vous remercier pour, encore une fois, pour la confiance et donc, à présent, inviter le secrétariat à prendre la parole s'il y a des annonces administratives à faire. Merci.
Oui, merci, Monsieur le Président. Au nom du secrétariat, je parle maintenant sur les instructions de Pamela et Paida.
Ah, d'accord.
Qui m'ont demandé, je crois qu'il n'y a plus des annonces de façon pratique, mais nous voulons inviter tous les ministres, tous les délégués à nous joindre pour danser à cette chanson We Are Family. Donc, je suis demandé à dire que nous n'avons pas fini avant que tout le monde danse We Are Family. Donc, merci. Merci.
D'accord.
C'est l'annonce que nous voulons faire comme secrétariat. Allons-y.
Merci, Madame la directrice. Nous allons tous danser alors.
We are family. These are good folk.
All right.
Wow.
We better start practicing for Togo. To join Togo.
All of the people around us, they say, can they be like us? Just let us stay for the record. We're giving love in a family dollhouse. We are family. Hey, and all my sisters with me. Hey, we are family. I got my sisters with me. We are family. We are family. Get up now. I got all my sisters with me. I got my sisters with me.
Merci beaucoup à tous. Bien, c'est sur cette note de réjouissance donc, que je déclare pour la 110e session du comité régional de la région AFRO de l'OMS. Merci à tous et à très bientôt.
À bientôt. Thank you.
Thank you.
Thank you.
Thank you very much.
Merci. À bientôt.
Thank you.
Até breve. Bye bye.
Bye.
Bye, doutor. Bye, doutor Marthe.
Bye.
Adeus. Au revoir. Au revoir. Adeus, adeus.
Bye.